All right, everybody, we are almost starting with this panel discussion, and let me tell you, we have a fantastic lineup of speakers for this session. Our moderator, Dr. Prem Jigyasi, Chief Executive Officer, Dr. Prem and Associates. Our panel members, Mr. Madhusudan Chauhan, CEO, Jiva Ayurveda, Mr. Abhishek KR, Director, Kerala Ayurvedic Group, Dr. Rohit Madhav Sane, Founder and Managing Director, Madhav Bagh, Dr. Anil Kamal, MD Ayurveda, Chief Medical Officer, Vaidyaratnam Govardhan Ayurvedic Hospital. And of course, joining us shortly, we'll have with us our session chair, Professor Vaidya Pradeep Kumar Prajapati, Director, All Institute of Ayurveda, AIIA. So we shall be getting started with the session in a couple of minutes from now. I would request all of you to please take your seats as we are about to get started with this very interesting plenary session for Ayush and Wellness Advantage, positioning India as the global holistic healthcare hub. Please take your seats as we are about to get started with this very thought-provoking session, ladies and gentlemen. Our panel members, our moderators are already here, eagerly waiting to start off with this session.
Should start.
All right, everybody, requesting everyone to please join us here at the conference hall. We have a full house of our speakers now. Our session chair, Professor Vaidya Pradeep Kumar Prajapati, Director, All Institute of Ayurveda, has also joined us. So we are good to start with the very first session. It's going to be Ayush and Wellness Advantage, positioning India as the global holistic healthcare hub. And we'll be starting off with the day 2 of the agenda in 2 minutes from now.
So we had a discussion already. Just briefly, after she will introduce us, we will go up. I will start the session and I will invite you to do a keynote or framework. You have any points to give at the beginning, or you want to do it continue? Oh, perfect. Yes. Then we will start the session with a question and answer, and we will go dive deeper into that. Okay? No problem. So.
All right, everybody, requesting everyone to please settle down. We are about to start, and we shall be starting in 15 seconds from now. Guru Brahma, Guru Vishnu, Guru Devo Maheshwara, Guru hi Sakshat Param Brahma, Tasmai Shri Guruve Nama. A very good morning, everyone, and a very hearty welcome to all of you to the day 2 of the 8th edition of Advantage Healthcare India Summit 2026. I am your Sutradhar, your host, Diksha Rana, and it is my absolute pleasure, privilege, and honor to welcome you all on behalf of FICCI. Ladies and gentlemen, after the successful completion of the day 1 of the conference and the 6th edition of the MVT Awards 2026 in the presence of our Honorable Minister Shri Gajendra Singh Shekhawat, Union Minister of Culture and Tourism, Government of India, we are back with the power-packed agenda for today. So ladies and gentlemen, without further ado, let's start off with the very first session of the day, and it is going to be a very interesting session. Ladies and gentlemen, this is the plenary session for Ayush and Wellness Advantage, positioning India as the global holistic healthcare hub. Ladies and gentlemen, this session will highlight India's strengths in Ayush and wellness and their growing role in strengthening the medical value travel ecosystem. It will also explore how Ayurveda, yoga, naturopathy, Unani, Siddha, and homeopathy, supported by initiatives like Ayush Visa and Ayush Quality Mark, are building global confidence in India's standardized traditional healthcare systems. Ladies and gentlemen, without further ado, it is my absolute pleasure to invite our eminent dignitaries on the dais. May we please acknowledge the presence of our session chair, Professor Pradeep Kumar Prajapati, Director, All Institute of Ayurveda, AIIA, to please join us on the dais. Our panel members, Mr. Madhusudan Chauhan, CEO, Jiva Ayurveda, Mr. Abhishek K.R., Director, Karali Ayurvedic Group, Dr. Rohit Madhav Sane, Founder and Managing Director, Madhav Bagh, Dr. Anil Kamal, MD Ayurveda, Chief Medical Officer, Vaidyaratnam Govardhan Ayurveda Hospital. Let's have a huge round of applause as we welcome our panel members and our session chair on the dais. I would also like to invite Mr. Srijit Adamam to please join us on the stage. And of course, our moderator, Dr. Prem Jigyasi, Chief Executive Officer, Dr. Prem and Associates, our moderator for the session. Let's have a hearty welcome for our dignitaries on the dais, ladies and gentlemen, as we start off with this session. And without further ado, I would now hand over to our moderator to please start with the proceedings of the session. Over to you, sir.
Thank you. This is working? Good morning, everyone. What a fabulous session we had yesterday. We discussed wonderful objectives of medical institution, how they are contributing the growth of India's healthcare ecosystem. And Vicky has put this fabulous event and international delegates coming here to discuss incredible topics. But today, we are notching it up with what India does best, which no other country. And I have had a pleasure and privilege to travel to 80 countries. And in 80 countries, I work, consult, guide on medical tourism and wellness tourism. No country has ever done anything for a systematic alternative medicines. And Ayush is one of the first initiative in the world, not only in India or here, across the globe, a ministry dedicated to entire alternative ecosystem. And our achievements goes beyond what we can probably produce on the paper and all, because there is an ancient science, history, and lots of information and knowledge that we possess. We have great number of institutes, and on top of those number of institutes, government has initiated something called Ayush Visa and Ayush Quality Mark as well. And these are exceptional things. Now you might ask that why we require alternate medicines and all. We spend $47 trillion money to manage the chronic disorders and lifestyle disorder. That amount is equal to if I feed every single person in the universe, feed them, give them education, give them health care, not for 1 year, but entire 15, 20 years. That kind of money we are spending every year, and modern medicine alone cannot solve those problems. And that's why we have eminent personalities here, fabulous people, first of all, great leaders, great institutes, by the way. They have done fabulous work, and across India, we have more institutes who have done fabulous job. So with that, I would like to ask my first question to our chair, Dr. Pradeep. Dr. Pradeep, please enlighten us with your institute, the Ayurveda work that India has done. And just to tell you, we would love to have interaction with you. So we are not here just to give you some information. Please keep your questions ready. We will have this session where we will love to have more discussion. Feel free to ask any kind of questions you have. So Dr. Pradeep, I would like to start with you, and then we will move to our other fellow speakers.
Good morning to all of you. Thank you, sir. I myself, Professor Vaid B.K. Prajapati, presently Director of All India Institute of Ayurveda, seeing the medical tourism value conference, especially for the more than 80 countries are representing here. So I am very thankful to all of you to come here and join this session. No doubt, there are so many things has been taken care by our persons belong respective to the government, to the private, and everywhere. And we are very happy to give you such type of the platform for doing everything for your social well-being, for your physical health, for your mental health. No doubt there are so many things going on everywhere in world in search of the better lifestyle disorders, better dietetics schedules. So for that, Vicky has taken care. No doubt, healthcare is a very important point nowadays, because generally we are focusing so many things, but everyone is suffered from the mental stress. Stress for their job, for their work, for their family, for everything. So how to we cope up with that situations? Probably I think this is the session which has given so many things to you, because I am seeing the persons are sitting on this dash, generally they are dealing with the international populations. So thinks it would be very good for us to do something in collaboration with different countries. And this medical value tourism started from the Kerala in our country. Now it's gone throughout the country because now we find so many wellness centers in different states. Though if they are along with the nature, then everyone prefer it. So it is found difficult to maintain the situations in Delhi, but I see personally the Jiva Gram, and they have maintained so much traditional value of our lifestyles with all the scientific explanations. So I think it would be better to see everything and discuss with this platform. Probably yesterday, in CEO meeting, so many things has been discussed with different countries. So certainly we found some good outcome of this particular discussion. So I think first all the persons will present their views, then we will conclude or discuss on the basis of that. It would be better for us. So thank you for giving me chance to say something on this platform initially, because these are the points where how there is some problem, because if you come on the tourist visa, without tourist visa, we cannot entertain the persons for the medical tourism.
Yes.
So it is a difficult point. That matter has been also taken up by our government with the different platforms. Certainly in future, we find some solution for that also.
Yeah, and it's just not about not able to treat, but they have so many benefit to get for Ayush visa
Yes.
and medical tourism visa. So many of our international guests are here. I would like to inform you that the government of India, thank you Dr. Pradeep, government of India have initiated fabulous visa program. Please do utilize those, because those are created as a benefit for all the international visitors, easy to renew them and for long term and then companion and all. And Dr. Pradeep, I really appreciate your contribution. Now let me go to all my speaker one by one. I would like to ask you, according to you, I mean, as I said, I had a pleasure in 80 countries and I go and talk a lot about how India is fabulous with Ayurveda, alternative medicines, Unani, naturopathy and all. But I would like to take your perspective, because you represent great institute of India, and I have seen personally work that each and of your organization have done. How do you think India is having an advantage, and how your institute is giving that advantage? Very briefly, if we could kick-start this discussion. With you, Rohit, yeah?
Thank you. So I think India has a huge advantage. The reason behind is, first of all, Ayurveda having a 5,000-year-old history of treating various disorders. Now, when I come from modern medicine background, I see that whatever diseases that have been treated in modern medicine, those diseases already have been documented by Ayurvedic texts long years back. And the treatment principles many a time sync with the modern medicine principles. And the best part that I see why India would be having an advantage is going to be, the first is the 5,000 years history. Second, I would see the collaboration part of Ayurveda with modern medicine has a very strong part into it. Ayurveda can be integrated, can be collaborated with modern medicine at various different levels. If at all that collaboration, that integration is being explored, I think Ayurveda can be the best possible way for the world ahead to integrate and take modern medicine as well as Ayurveda together. And that, I think, is the most important advantage that India has. So India should take that advantage and take it ahead.
Oh, this is fabulous. Yeah. Abhishek, especially, you would share some words about India, but I would also want to know from your perspective, as you have set up a great institute across India as well, and also planning to go global as well. Please do share advantage of India and how this institute look forward to it. Yeah.
Just to give a short background, we at Kerala Ayurveda, we are fourth generation into practicing and promoting Ayurveda India and worldwide. We have one of the largest hospitals in Kerala, which is set up like a retreat, like Dr. Pradeep was mentioning. It's in nature, so 65 acres of nature with 30 villas where we are taking up patients from all over the world. Currently, 80% of my patients are international. Along with that, we have 13 clinics in 5 countries, and we are also manufacturing 180 drugs and exporting it to 15 odd countries. So coming back to what Premji was saying, I mean, not just Ayurveda, but the Ayush stream of treatment looks at a patient holistically. And I believe this is the only system or within the Ayush streams where we look at each patient holistically and not just treating the ailment, but looking how to rejuvenate and ensure that the ailment doesn't come back. And this is quite unique in terms of an approach where we're just not just looking at the root cause, but also eliminating the cause and also guiding the patient as to what needs to be done so that it further doesn't come back into their system, right? So this advantage that Ayush has, I think, helps out everybody. Secondly, we have treated over 1.5 million patients with 93% success rate.
Wow.
So this documentation of treating various patients gives us the advantage and also gives us a position that we can take care of most non-communicable diseases, and that's where we focus as an organization, right? Yeah. So we don't take up any kind of patient. We have clarity as to what or which kind of client or patient we want to take up. And this puts us and India in a very peculiar position because we are giving health back to the citizens of a different nation, which gives us and India such goodwill that no other treaty or trade can, right? Yes. So this is like putting India in a soft power kind of position, and as a patriot, I'm really proud that the government and we and all these organizations, we're promoting our holistic science of Ayush and Ayurveda across the globe.
Thank you. Thank you. Dear Madhusudanji, again, fabulous work that you have done. Let's put Ayush perspective. And when I refer Ayush, I'm referring everything that we have, be it a naturopathy, Ayurveda, modern, medical wellness science, everything that you could bring it to the picture. Yeah.
So thank you very much, Premji, for that lovely intro to the session, and thank you, Vicky, for organizing this important dialogue. I think this is a very important gathering because all the stakeholders are present here, the modern medicine community, the Ayush community, our international health community, people traveling from all over the world, and the Indian medical value travel community. Foremost, I think it is not a new discussion, Premji, because when we talk of medical travel to India, probably India was one of the first countries to establish this as an industry. Historically, you go back 2,000-3,000 years ago, there are documents that mention people traveling from the Mesopotamia to Egypt, from Chinese civilizations to the Greek civilization, people traveling to India for taking treatments, including cosmetic surgery. And these are documented, documented from travel logs of different people coming and traveling to India. So thereby, it is not something which is new to us. This is something we probably started. Second thing, the graduation of the industry in the modern times now. I was in the CEO roundtable, and yesterday the discussion was not as much around, interestingly, the cost and the value travel, but more about quality and outcomes-based healthcare delivery, which is very important, right? Which also shows the maturity of not just the Indian health sector, but also the demand and the request of the people who want to consume.
Yeah.
Third, integrating not just the surgical procedures or the cosmetic procedures, but a view to health which is more holistic.
Yeah.
Today, about 300 million people worldwide do yoga. That is a significant number.
And more than 190 countries
In
has
more than
accepted
190 countries.
Yoga
Correct.
Day, and they do.
Right. I mean, I'm sure, all the guests that are traveling from abroad, they have seen with what, warmth the Yoga Day is celebrated internationally.
With just that fact, let me tell you one more fact. The global wellness tourism, which is $5.4 trillion industry, the recent research says more than 60% organization, be it in medical or whatever, they are now keen to bring alternative yoga, meditation, naturopathy within their system. More than 60%
Interesting.
organization, which is a fabulous achievement, by the way. Yes.
Correct.
Please.
No, very truly mentioned, and that brings me to my third point, which is the view of health globally is changing from not just intervention oriented, but something that enables preventive care, promotive care, maintenance, intervention, and post-intervention. So this entire spectrum of health we need to look at.
Yes.
Ayurveda, yoga have certain strengths. In what parts of this entire continuum do we add? Modern medicine has its own strength. So thereby, India as a country is very uniquely positioned to sort of bring all the members who are sitting in the room today together and create a unified world view to what the healthcare for the world as a global citizen should look like, which enables more affordable healthcare, more quality healthcare, and more prevention-driven health interventions.
Thank you.
At Jiva, we run one of the largest telemedicine practices in the world for Ayurveda, where we consult patients from over 35 countries. And we see the kind of interest Ayurveda is developing. Not just people who want to travel to India to consume Ayurveda, but also want to bring it to their respective countries. So I think the time is right.
Thank you. Thank you so much for such a wonderful thought. Shrijit, you come from organization which has set benchmark in the medical industry. And I got acquainted with Apollo Ayurveda long time back, and I'm very much aware about the protocols that you follow and all. So how do you see, when you already have a huge medical institution also and you bring lots of wonderful alternative things also, how do you see India positioning itself? How do you see as an institute also that how you're contributing? Yeah.
Thank you. Good morning, everybody. Thank you for this opportunity. I'm Srijit Adamana, Chief Operating Officer of Apollo Ayurveda. To specifically answer your question, I think there are a few quote-unquote tailwinds in the global market which kind of enables Ayush to be at the center of that whole healthcare transformation, right? Like Madhusudan mentioned, right? I mean, the whole definition of health is changing. If you look at UN Sustainable Development Goals, SDG 3 has moved on from managing non-communicable diseases or anything from that to a broader definition of enabling health and well-being for all. That became an imperative because if you look at this emergency care, so to speak, addresses probably 30-35% of the healthcare demand, and the remaining 65+% of demand is in the non-communicable diseases space where things are not yet emergency, right? So from that angle, what happens is while conventional medicine has solutions, it needs to be, there is global recognition that it needs to be a lot more holistic, right? Having a pill or taking a medicine alone cannot address. There has to be an intervention along diet, lifestyle, and multiple paradigms. And these are all, very, very proven and right up to the alley of something like Ayurveda. We have been practicing it for 3,000 years, and there is significant benefits when it comes to non-communicable diseases. And the lines are also getting blurred because people are not just talking about one non-communicable disease. People are saying multi-morbidities, right? US healthcare says that 75% spend happens in people having multiple comorbidities. So there again, we need to shift from a disease-centric approach to a patient-centric approach. This is again an Ayush core strength where we don't talk about the disease but look at the patient as a whole.
Exactly.
And it also becomes more important because people are also aging. Now longevity is a big point that comes in across the world. People are looking for solution. People are saying more so post-COVID, the awareness of preventive care has come in. So where is that window of opportunity, right? Somebody is saying that I want to prevent an onset of a condition, say like diabetes, or somebody is already diabetic, can we prevent onset of complications, right, from that is coming in. So everywhere, or somebody is coming out of a surgery, is there an opportunity for us to prevent the recurrence and bring back the quality of life? All these are sweet spots for Ayush-based systems. And to answer your last question, what is India's competitive advantage is going to be? I think integrative medicine is going to be a silver bullet for us. And when we meaningfully integrate, at Apollo Ayurveda, we also get a lot of opportunities to not only work on traditional Ayurveda, but also integrative medicine. The beauty here is that, no, this is going to be a very unique solution, which no other country can replicate, be it Thailand, be it Malaysia, and any of these countries, right? So this is going to be something very unique for India, and this helps us to move away from a price or location-based arbitrage to a more, like all of you mentioned, right, quality as well as a unique solution-based arbitrage for the world. That's going to be our vision, and that is what even our respected Prime Minister mentioned during the Traditional Medicine Summit, that this is going to be the way forward for us. Thank you very much.
Yeah, and in fact, it's fabulous topic, and you set perfect stage for Dr. Anil, because they are already practicing lots of integrated medicine. He represent Bhaktivedanta Hospital, as well one of Ayurveda Institute, Vedratnam Govardhan, and along with a wonderful Ayurveda and integrated medical practice, they do lots of wonderful ethical practices as well. Anil, please enlighten us. What is your take on Ayush, as well as how do you see your organization contributing?
Good morning. Thank you for giving an opportunity to share some of the thoughts behind this same, that where Srijit is given a stop, from there I am starting. There is a tremendous opportunity to make an integrated approach to, not for a disease oriented or disease correction, it is to give a total health backup. We are focusing not only the medical management, we are focusing a total health management overall. Then only that will be work. We are having an allopathy hospital, a 300-bed allopathy hospital. We are starting from there to make the diagnosis part. And when the diagnosis is happen, we will be sit together. A panel of discussion is happening with Ayurveda, naturopathy, homeopathy, all together will be sit. And the general medicine and any specialty doctor is needed, that specialty also will be sit together. And we will be getting a conclusion that which various areas where we can be give that integration can be approach, integrational approach we can do. With that we can provide a good holistic care to the patient. So that once they are going with that Ayurveda or homeopathy, etc. and all, continuously we are monitoring, the panel will be monitoring, and wherever any integration is happen with any other system it is needed, that also will be provided to them, and getting a good outcome based clinical management we can offer to the patients who are approaching to us. It is a totally evidence-based clinical approach and getting a good result also for us. We are also handling more than 60% of international guests at Govardhan Eco Village for holistic health care, Ayurveda, with so many other integrated part, sound healing, nature walk. It is a serene atmosphere which is happening over there. So automatically, in Ayurveda, there is a 3 types of approach in Ayurvedic way of treatment. One is Yukti Vyabhasara Chikitsa, that is the general thing which is happening in everywhere. That is a doctor-patient relationship with the medication, treatments, etc. Then secondly, it is coming that Sattva Vyabhasara Chikitsa, that is mental rehabilitation. It is very important, because when we are giving a support for the mental stability, there is very more chance to get a more than 80% recovery as such from our innate strength itself. It can be happen. So the mental health, it is one of the, it is coming under the Sattva Vyabhasara Chikitsa, and another is the Deva Vyabhasara Chikitsa, that is previously and all it is connected with the Ayurveda. It is followed with all type of regimens that is rituals which is can be happen. That kind of facility also we are providing at our center, so that this all type of treatment modality we can do with a holistic way of approach. Thank you.
Great, great, dear Dr. Anil. So we heard fabulous word about how Ayush in India is doing and how these incredible institutes are doing. But let's move on to a larger picture and not from your individual industry standpoint. As a moderator of session, I would like to throw some hardcore questions, the pain point of the industry. As I said, I travel to 80 countries and often I get so much appreciation about Ayush and India leading the front, but at the same time, one question constantly comes. And Professor, I would like to start with this up. Rajji, I would like to start this question with you. What do you think about evidence-based care Ayush is doing? How much, and I'm not talking about one organization specific, overall India, how much we are doing on that evidence-based care, how much records we are sharing, how much success rate we are sharing, as like the way modern medicine is doing. Have we done enough, or there is a way to do enough? Please enlighten us on that point.
Very good question, thank you. There are so many things is available nowadays because in scientific world, everyone needs some evidence. So on that basis, so many institutes, so many our now industry is also involved in that perspectives by incorporating the clinical trials. ICMR is working on that, CSIR working on that, CDRI working on that. So there are so many institutes are working on that particular aspect along with all the main institutes like AIMS, IIM, IITs. They are supporting us for the evidence generation, because no doubt, though being a Ayurvedic expert, in our opinion that we are evidence based. There is no problem, because so many things has been especially written in our classical text that are on the basis of that time observation, not on the basis of their brain generated question or even generated answers only. They are on the observation of the mass observations, and they have written on that particular issue, and that data is nowadays on the basis of modern scientific lines. They found that that data is now accepted as a whole, because rarely the standard deviation and standard error is rarely 0.001%. So this type of data is now available, probably on the,
And sir,
I think more
you
than
do-
40,000 scientific publications are available on our website in Ministry of Ayush.
Let me ask a question, and on behalf of everyone, and it's a fabulous point that you are sharing that we have great evidence. In general, you think across India, is this practiced very well, or there is a scope of improvement of practicing that?
No, in India, if you find that in two parts, there are rural and urban parts. In rural parts, it is practiced as a whole till now, because we, in urban part also, when we find something, then we go on our kitchen side and take some things from that. So it is practiced, but it should be in scientific explanation on the basis of present pharmacodynamics and pharmacokinetics. Then it will be better to understand
Great.
for common public.
Great. This brings to me, Dr. Rohit, you have fabulous programs, sometimes chronic disease management, diabetes reversal program, and you do fabulous work. How important it is to have a clinical data relevancy when you talk about the program that you are setting it up, and how do you go ahead and probably educate people here that how do you go ahead, publish that information, what kind of evidences you would like to share, and how important is evidence-based program?
According to me, evidence-based program is the most important thing. There could not be anything other than evidence-based kind of communication. For me, when Ayurveda is supposed to be communicated to the masses, what is important is how strong is Ayurveda in treating a disease. That is what layman understands. If at all the layman has done his few pathological, biochemical markers in the past, and he has come to an Ayurvedic doctor with those pathological studies, and he wants those things to be improved, or else maybe radiological studies, or else maybe angiographical studies, if at all he wants those things to be improved, that should be the deliverable from the Ayurvedic doctor. So according to me, the clinical data that has to be published is very important. At Madhavbagh, when we have about 350 clinics and 5 hospitals, we have published about more than 150 research papers till now in various different allopathic peer-reviewed journals like Lancet, like JACC, as well as Indian Heart Journal and many more. So publishing a clinical data is very important. Now, how to get that from a clinically practicing doctor is going to be a challenge. Excellent. Because there are several Ayurvedic practitioners who do practice and they do show improvement on their patients. Now the question is, when we call it as evidence-based practice, what do you mean by evidence, and who decides this evidence is going to be important. Like for example, there is usually a battle in between Ayurveda and allopathy, that Ayurveda won't use those allopathic typical or else modern scientific parameters as their evidence. No problem, there could be several other evidences that can be proved upon, but at the end of the day, it is going to be the evidence-based practice which is going to be important for the patient, for the doctor, for the global outreach. Everywhere evidence is going to speak in the future run.
Great. And when we talk about the evidence, Abhishek, this question I must ask you, because you said that you do evaluate patient or customer or guest before he comes to you. You evaluate and then decide whether you want to take that patient or probably you want to set up the program and all. How important it is for organization like you to set some parameters, how they go ahead about it, what plan they do it, what are the activity, how do you put up your protocols, planning, and how do you differentiate a normal wellness guest which goes with hotel plus spa rather than a proper healthcare driven, medical science driven Ayurveda system? How do you develop that structure?
I guess that question is coming from a background because you see Ayurveda in every hotel nowadays, right? I'm also culprit to it because we also help resorts and hotels set up their Ayurveda section. So there is a bit of dilution that happens in that sense. And it is also confusing for clients and patients because Ayurveda has something quite unique which is documented, which they call Sukha Chikitsa and wellness, which they had thought about 5,000 years ago. Right, that you don't need to take care of your body once it's broken, take care of it before that, right? So the entire Western culture of spa, which has also been brought into our culture, now we see a lot of people going to the spas, where Ayurveda is offered. But on a government standpoint of view, a genuine hospital will have the necessary accreditations like an NABH accreditation, which defines that this is a serious healthcare center, and any 5-star hotel that is offering Ayurveda, you should understand that it will be the most diluted version of an authentic Ayurvedic treatment, yeah? With that said, a wellness seeker may want to come in for a feel-good factor, may not have his parameters in check or have it documented that they would talk to a doctor and have clarity as towards the end goal of the treatment or service. Whereas a patient who's coming to us, say in our Kerala facility or one of my clinics, has a clear outcome in their mind and they discuss it with our doctors, and the doctor, we leave it up to the doctor to guide what would be the best line of treatment, protocols that needs to be followed. This is already our SOPs are already documented within the organization, and most of the doctors then follow that, right? And we guide each patient as to what they need to do during
is-
and post
And it
the
is
treatment.
extremely important to set up this kind of protocol for, you know, Ayurveda kind of setup, right?
100%. Without these protocols, we can't deliver the necessary outcomes that the patient is looking for.
And how do you see across the industry very quickly? Is it followed properly, or there is a scope of improvement there?
I can only comment on at
No, in
my
general,
organization
it's
level.
lovely to have a broader discussion sometime, really.
Sure.
It's good to have a debate also on that.
So on an individual clinical establishment, there will be many doctors practicing at the private clinics. Protocols will be definitely determined by how they got educated and which state they got educated from. I would say Ayurveda is so diverse within India that each state practices it differently.
Exactly.
Okay, so Kerala, a Kerala doctor and say from South India, for people who don't know what Kerala is, and a North India doctor, their line of approach towards the same patient might be different.
Yeah.
Even though at the background their thought process might be same, the products that they use might be totally different, even though the outcome they're looking for might be same.
And just want to bring a very good point here. FICCI did a very good event in Kochi, Kerala, and they had a fabulous 1-hour TV program. It's a fabulous, you must watch if you get the chance. You said that how you decide evidence, everyone has a different evidence. In that, they discussed that what we are talking about parameters and evidence, those are created for modern medicines. Ayurveda might not have result on those parameters, that this is your cholesterol, this is particular level, those are for modern medicines. While breath work, meditation, sitting in the yoga might not give you those parameter indication, but it definitely works, right?
Yes.
So I completely agree on your point that Ayurveda has a very different set of activities as well. Thank you.
And like I said, so one major aspect that we have to also look in Ayurveda is the diet of the patient, right?
Exactly.
So then we also have to ensure that where they're coming from culturally, will they be able to maintain the diet once they go back to their hometown or their home country? So we do have to look into that along with the other parameters that are set.
Thank you. So after the evidence, let's move on to very beautiful topic, and we just had a fabulous summit in India on technology front. India wants to lead in AI world and technology front. So particularly, dear Madhusudan, you said about telemedicine, right? You said to me that your initiative, one of the largest in telemedicines and tele-wellness kind of initiative. How do you think India, who's actually ahead in technology, our UPI payment system, I traveled 80 countries, never seen something like that. Never seen anywhere something like that. And we are really leading. How do you see India going ahead using technology, be it telemedicine, tele-wellness, artificial intelligence? And just to set a framework for you, I did my own dosha profile. My father is Ayurveda doctor. I did my own Vata Pitta Kapha dosha profile and did a research. My dosha profile came 95% accurate by AI, and overall across the globe, 82% time AI can give you very good dosha profile. So do tell me about intervention of technology with
Sure.
Ayush.
And if with your permission, if I may make a comment on the evidence-based as
Absolutely,
well, because it is
absolutely.
linked to the
Would be
use of
such a
technology and AI as well, right? Because the question is, why should we be using AI? Why should we be using technology? What is the purpose of it? I think Dr. Rohit rightly pointed out, we need to not look at evidence-based research or evidence-based Ayurveda practice from a myopic lens of defining how evidence is being generated, but from a broader perspective of agreeing what is evidence generation. It means that we are looking at a defined set of problem ailment candidate, undergoing a specific methodology, a line of treatment which is also well defined, pre-declared, and we are mapping out the clinical outcomes and the impact of these interventions being made in an objective way, which is measurable, right? That is evidence. Now, as per Ayurveda, from a broader industry standpoint, there is, probably it is not visible, it is not seen, but last 20 years, the kind of effort which has gone in both by the government institutions, by institutes of eminence in the country on Ayurveda, and some of the private players is really setting the tone for what evidence-based Ayurveda should look like. Just to point a couple of things out, evidence generation in the pathy needs to happen, one, at the level of the science, what Sir was mentioning, which I think, you know, institutes like AHCI and NIA Jaipur and some of the other, BHU is there, Hassan is there, AIMS are now setting up different departments which are putting in a lot of science of Ayurveda kind of research orientation. And the second kind of data is at the level of practice of Ayurveda. So whatever practice is happening, how is it translating into clinical outcomes? Now at that level, I think last 10, 15 years, a great amount of infrastructure and studies have been published. Just last December, 2 months back, WHO held its second Global Traditional Medicine Summit in New Delhi, not far from where we are sitting. There, a traditional digital library was inaugurated by our Honorable Prime Minister and Dr. Tedros of WHO. If I'm not mistaken, I think 60% of the research publications published as part of that global platform were from India, were based in the Ayush systems. That speaks of the volume of data, research, published amount which is already out there for it. Having said that, I think it is not enough what is out there already. We are at the beginning of showing that evidence. There is significant amount of evidence already available. We are probably in the nascent stage in this journey. A lot needs to be done still. There are select institutions which are going about it in this fashion. You know, I mean, I can clearly vouch for all the institutions that are sitting on the dais here, that these are institutions who are leading the thought and the practice and the pushing the envelope when it comes to that evidence-based research. At the same time, a large part of this practice still needs to adopt this kind of a fundamental thing.
In fact, you are setting up, you know, everything so beautifully for me also to move forward to this also.
So coming on the technology front, which you mentioned, the way we've leveraged technology at Jiva is for two things. One is creating greater access and ease of access. So today, we get patients from as remote places like Balia and Junjunu, which are villages in the country which have, some of them areas don't even have access to any kind of healthcare facility. And we get patients from developed cities like London and New York and Tokyo and Sydney. The kind of ease of access we are providing to a high quality Ayurvedic Vaidya doing quality protocol based Ayurveda treatment, that enables. That's one use of technology we are making. The second and more important use of technology is further enabling evidence generation, standardization of protocols, delivery of protocols in a standardized manner, measuring the outcomes, and thereby holding the physician and the organizations accountable for delivering outcomes in Ayurveda. That is where we are using technology. We have created machine learning powered decision support system for an Ayurvedic doctor. So when this doctor is consulting each patient, not only he's being guided by algorithmic decision support system, which improves the quality of his diagnosis, which enables him to choose the right personalized line of treatment and interventions to be made into this patient. But at the same time, there are algorithms running which go back. We have a library of about 3 million documented patient cases. It goes back into this library, looks at high quality, high degree of relief in similar snapshotted cases, brings it back to the Vaidya, gives a recommendation which is done on a big data analysis basis. The Vaidya chooses, the system learns.
Great.
So thereby we are using technology to further enable data-driven research in Ayurveda.
Fantastic. So this is followed with our wonderful summit that we had.
Now, Srijit and Anil, I'm going to throw some tough question to you because we had a fabulous discussion so far. Srijit, I want to give you sweet time to prepare your answer. What are the actual challenges you face in an organization when you say we want to integrate? What are really integration has operational challenges? Are the medical doctors ready for that integration? Are we talking about outcomes which are really measurable? Is that something you are seeing within industry, not in your organization? I want to give you sweet time. And Anil, I would like to come to you a question which is little different. What do you think about importance of trust in all this ecosystem? Does patient trust enough on this Ayush ecosystem when patients are coming from abroad? I see so many patients are coming to you from different country, different culture. And what role your organization is playing to create that ethical trust, evidence-based trust and all. But I will also give you a time. Dear delegates, please keep your question ready. We have eminent, prolific speakers, and I want to ask you some great questions. So keep your questions ready, and I'm going to come very soon to you as well. So, Srijit.
Thank you, Dr. Prem. I think it's a good question. I was thinking how much time I have, right, to answer this.
Just few minutes, you could
So the first question about the challenges of integration, right? So please understand something, right? Right now we operate around 14 centers across the country. We are present in all the metros, right? And we are running NABH accredited protocols-based care for the last 20 years, right? When Ministry of Government awarded us for the protocols, one thing was very clear. We have this protocol, Precision Ayurveda protocol, which is actually evidence-based, right? I mean, there is right at the beginning, there is differential diagnosis being done in wake of clear clinical evidence. The provision of, the plan of care is made based on Ayurveda textbooks as well as what the patient wants, based on the differential diagnosis which is given, and the provision of care as well. So there again, we clearly document outcomes, both patient-reported outcomes as well as we track the outcomes which are standard biomarkers, which are international scales. We also do quality of life outcomes, So what happens is that there is truckloads of data we capture. For every patient, we capture around 1,000 plus data points in lieu of this kind of an approach that we follow. So what happens that if you see this patient, and we also have started publishing in our website the kind of clinical outcomes we deliver. Now tell me one thing, forget about Ayurveda. Let's go to convention also, right? Not many people do this kind of publication of clinical outcomes or, tracking of the outcomes at these levels, right? So that itself brings in a tremendous amount of trust when it comes to integration. Point number one.
True.
Point number two is that a lot of time, and this also brings in the communication aspect, right? A lot of time what happens is that Ayurveda has a particular line of treatment and it's a science, right? And it's a systems-based science, but not everybody is educated in that system, right? So sometimes when we talk about it in our own languages, it comes across as Greek and Latin for people. So that's where the importance of translating it into understandable terminologies, right?
Thank you.
That becomes very critical. So if you take a step back and say that, no, I treat cancer rehabilitation, I do cancer rehabilitation, or I do stroke rehabilitation, what do I address? I can say that, one of the major enablers of cancer, if I take cancer as a use case, is inflammation, right? That's going to be a major piece. And Ayurveda has well-documented solutions for inflammation reduction.
Exactly.
So that's the place, that's a sweet spot we need to crack, be it talking to a modern medicine practitioner or talking to a patient, because they understand how exactly this mechanism works. So it takes a lot of effort for us to build that communication. And coming to the last point on the trust factor, absolutely yes, everything works on trust, right? In 2017, when FICCI awarded us for the MVT, one of the premier institutions, yesterday was award night, I think Kottakkal won it, but when you awarded as early as to 2017, one of the pertinent problems that time was also that how do we communicate effectively what Ayush systems can bring? And that problem stands today as well, right? Many people come in and they don't really understand what exactly we can offer, what we cannot offer, right? Like Madhusudan mentioned and like Mr. Abhishek also mentioned, we cannot overpromise, we need to deliver what we can deliver, but at the same time we need to bring that clarity into the patient's mind also, right? What we can deliver. Because unfortunately a lot of patients come to us still as the last resort, right? They have tried multiple systems and they coming to us. It's very important for us to set that expectations. The moment we set expectations, the trust is built, and the way we capture documentation and outcomes, the trust is further enhanced. And when the patient goes back happily, we can see that the patient brings in another 100 patients, the facilitator is super happy, So lot of this communication currently happens organic, and if I were to have an ask, it is time for us to stand up and actually document some of these things from an institutional level.
Which is very, very
Right?
important,
Yeah,
as
and
the
here in
industry
India
we
or
need to
whatever.
do it.
Okay, time up. I think, yes.
Dear Anil ji, please, your words on wellness topic like ethics and trust, importance of it, and then I will go to the audience questions. Dr. Anil, would you like to share your thoughts of the importance of trust very quickly? And we have
Thank you. For importance of trust means one is that approach of a patient-doctor relationship. That is the very, very important for evidence-based clinical practice. Because doctors are not having proper time to sit with the patient and know what they need exactly. That is a very important thing. So there we are lacking main thing. So we are going with a protocol-based treatments aspect and all it is doing. It is not the way which is textually referred in Ayurveda 5,000 years ago. The patient to be noticed what is the exact problem to them and what is the solution for that to run for a healthy condition, not only for the healing of the present the disease condition. This is the thing that doctors want to be very much clearly advise the patient, then only that can be happen. And mostly in Ayurveda point of view, when I am thinking, because Ayurveda is which is more gap between the normal people to Ayurveda, because they are focusing that it is to be, once we are going to the Ayurveda, we want to be strictly followed some of the pathyas. Pathya means some of the strict diet and all. It is not the way it is that. Pathya means which is good for the condition to recover which is happened over the body. So what is their lifestyle, their food habits, that to be noticed, and which is to be deleted, which is to be added. That is the only thing it is happen. It is not like only that avoid. It is not like that. Something to be avoided, something to be included in that. This
Thank
kind
you,
of
Dr. Anil.
approach
I
is
know
very
we have
important.
lot to share, but allow me please to take one or two quick questions. We are actually running a bit late. Yes, my friend, can we have microphone to a big represent a wonderful organization, medical tourism.
If nobody else have any question, I would like to summarize in it 3 questions. I think that should answer all the
Okay,
doubts.
just to my panelists, in case if you try to answer in one line or one sentence or something short.
While during the discussion, we discussed about 4 kind of Ayurvedas here, right? First is the therapeutic Ayurveda, Madhu spoke about, Srijit spoke about integration, Anil spoke about integration, and then Abhishek spoke about the spas, and Dr. Rohit spoke about the wellness. You know, when we are talking about 4 different Ayurvedas within one different Ayurveda, within one spectrum of Ayurveda, for the global kinds, are we not confusing them? That's my first question. Second, we spoke about the
I
evidence-based.
think so. Let's start with that because we are actually running out of time.
Up to
And
you.
I guess my fellow panelists will be here around, right? So if any of you have more questions, we can be here around and answer. Would you like to answer? Yeah, quickly.
I think nobody could have been more spot on. Completely agree, and we very, very strongly are of that same view that when we are discussing therapeutic, curative Ayurveda, it cannot be put in the same sentence as wellness Ayurveda. They are very, very different propositions,
Therapeutic
products
and, yeah.
altogether. A lot of the time from an international eye or an outside-in eye, for them Ayurveda is hot oil dripping in a
Only
relaxing
massages.
state at a beach or in the mountain. That is a part of Ayurveda, and that's not the Ayurveda we are discussing. We are discussing therapeutic, core, treatment Ayurveda, and I agree with you. I mean, I'm sure if all the panelists would.
So with that, I would like to please give a big round of applause for our great panelists here, especially with Dr. Pradeep and all the team member. Thanking you. All is yours, ma'am.
Thank you so much, Dr. Prem. Let's have a huge round of applause, ladies and gentlemen, for the fantastic panel that we just witnessed. And with that, I would now like to invite Mr. Ishan Pandita, Director FICCI, to please felicitate and honor our panel members. Can we have the mementos, please? Starting off with our session chair, Professor Vaidya Pradeep Kumar Prajapati, sir. Let's have a huge round of applause, ladies and gentlemen. Thank you so much, sir, for joining us today and for gracing the occasion with your presence. Followed by our panelists, Mr. Madhusudan Chauhan, Mr. Abhishek K.R., let's keep the applause going, ladies and gentlemen. Dr. Rohit Madhav Sane, Dr. Anil Kaimal, Mr. Srijit Edimana, and of course, our fantastic moderator, Dr. Prem Jigyasi. Let's have a huge round of applause, ladies and gentlemen, for the fantastic moderation that sir did. I would now like to invite all our panelists for a group photograph along with Ishan sir.
Please. Come, Ishan. Please come.
So ladies and gentlemen, with that, you were witnessing the plenary session for Ayush and Wellness Advantage, positioning India as the global holistic healthcare hub. What a fantastic, thought-provoking panel discussion that we just witnessed. Thank you so much, Mr. Ishan, for joining us and for felicitating our delegates.
Question,
On behalf of FICCI, I would like to thank our panel members, our moderators, and our session chair for joining us for the fantastic panel discussion. We'll just take a minute more to set the stage up for the next session, and then we'll get started. Thank you, sir. Now starting off with the next session, this is going to be a workshop from travel to medical value travel, the role of Indian travel companies in positioning India as a global healthcare destination. Ladies and gentlemen, this workshop will provide an overview of key medical value travel business models, essential operational inputs aligned with the Government of India's vision for MVT, high potential target markets, go-to-market strategies, and easy-to-sell medical travel products. Ladies and gentlemen, this session will also feature interactive discussions with leading MVT stakeholders, offering practical insights into market opportunities and business development. So with that, I'll stop now and invite our presenter for this session. Ladies and gentlemen, please give a huge round of applause as we welcome on the stage Mr. Abhik Moitra, President and Managing Director, HBG Medical Assistance. Hearty welcome to you, sir. And with that, I would now hand over to sir to start with the proceedings of the session. Over to you, sir.
Thank you so much. Good afternoon, everyone. This session, which is a workshop specifically designed for those travel people who are already engaged in the travel business and who would want to get into a medical travel business. May I kindly request all those people from travel industry to raise their hands, please? Okay, please, can you come forward? There are a lot of seats empty, and if I can request everybody to come forward so that it doesn't look empty. It gives us a lot of confidence when the hall looks a little tied up. Please, all those backbenchers, for once, we leave the habit of being a backbencher and come forward.
All right, can I request everyone at the back side of the hall to please join us on the front round tables? Our lovely audience sitting, standing towards the back round tables to please join us on the front tables. Perfect. Over to you, sir.
Thank you so much. Good afternoon, everyone. Good afternoon, dear audiences. This is a workshop, not a typical panel, where we are going to learn the business of medical travel. But before I start, may I kindly request my co-panelist, Dr. Manoj Kumar, to come on stage, please. Dr. Manoj. Dr. Manoj has now been promoted, right? Congratulations on your promotion, Manoj. Now, Manoj heads the entire sales and marketing piece for Artemis Hospitals, which is one of the leading hospitals for medical value travel. He is ably supported by Mr. Divya Shah. Divya heads the international piece for Artemis Hospital. He has been very, very instrumental in promoting India as a destination for healthcare. Divya. We also need Mr. Navneet Malhotra. Is he around? He's coming. Okay. He will be joining us shortly. Ladies and gentlemen, my name is Abhik Moitra, and I run this company called HBG Medical Assistance. I have been doing it for the last 16 years, and I am greatly honored because of the support that I receive from variety of hospitals. This particular session is a workshop where we are going to learn how the business of medical travel is to be done. I share my experiences, and I share the experiences of Manoj, who has been instrumental, who has been part of this medical value travel industry, and Divya, who has been leading Artemis International Peace for some years now. So they have shared their experiences, and all these experiences we have put together in a presentation. So ladies and gentlemen, welcome to this session, the business of medical value travel. Okay. So what is the business? What is the business of medical travel? And this is a very commercial aspect because we want to invite the travel companies into this business. And we understand that no business can happen without the commerce attached to it. So I'm going to give you a simple example. A patient who comes to India on an average spends 600,000 Indian rupees on a medical bill. Am I right, Divya and Manoj? Roughly that is the average. 20% of this patient becomes the earning thereabout. Somewhere it is 15, somewhere it is 25, depending upon what treatment it is, etc., which works out to roughly 120,000 Indian rupees. Am I right, sir? If a company, a travel company who does, let us say, 1,000, 2,000 customers for whom they plan holidays, who plan travel, etc., even if they do 1,000 patients in a year, your revenues goes up by 12 crores. We were waiting for you, sir. Mr. Navneet Malhotra on stage, please. He heads the international piece for Medanta Hospitals. And that's just the piece. But where your business is that of ticketing, hotel booking, and other saleable items. So we need to add that revenue on that extra set of customers. So that is the context. And that's just the commerce. But when you are giving somebody a holiday, you are adding relaxation to the minds of those people, families, etc. But when you are doing medical travel, you are saving a life. Let us also remember that. We are saving a life, somebody having a cancer, somebody who is going through severe back pain, they come, they travel and get themselves treated. So you are also instrumental in saving a life, which is earning for a lifetime. Now, with that context being set in, let me define what medical travel is. Medical travel is very simple. When a patient is seeking healthcare outside his or her own country of residence, he travels to seek that healthcare, travel to get that surgery done, travel to take that treatment administered on him. Now, there are a variety of reasons why a patient would travel. When a treatment is not available locally, and I'll keep giving you examples. For example, Kenya as a country has a very wonderful medical system, but they don't do bone marrow transplants because that particular treatment is not available. So a Kenyan patient who needs a bone marrow transplant will have to travel. When an outcome is compromised locally, even if some of the doctors are trying, they are still in learning phase, and in complicated surgeries, the outcome becomes very, very important. And because of the lack of experience of the doctors locally, the outcomes then get compromised. So all those patients who are seeking a better outcome, a better prognosis, they then travel to those countries where they are assured of an outcome. When the cost is very, very high, in countries where the manufacturing facilities for pharmaceutical, manufacturing facilities for implants, devices, etc. are not there, where the doctors are not homegrown, the nurses are not homegrown, and there are a lot of Middle Eastern countries in this, they have to import everything. Given the cost of import and logistics, their input cost goes up. As a result, their final pricing for a surgery, for a treatment is very, very high. And when they do a comparative analysis, if I'm going to travel to India and get a knee replacement done in $4,800, instead of getting a knee replacement done in $7,000 in locally, they still end up saving a lot of money. So when the cost of a local surgery done is very high, a lot of people would prefer traveling, and traveling in destinations where they can save some cost. When the waiting times are very high locally, for example, when they go to UK, the waiting times there for a cardiac surgery is about 183 days. And that is after an angiography is done, where the waiting time is almost 45 days. And that is after a consult done, when the time between the consult and an angiography is also roughly about 40 days. So by the time a person falls sick, has a cardiac issue, and the time he gets a surgery done, it's almost 280 days. And that is a time which can make a person live or die. So they want to save on that time, and then they travel. When there is a better technology available, for those people who do not know, India is the only country to have 2 proton centers. And we are investing very, very heavily in technology. We have more than 60 robotic surgical centers in India. We have been dealing in technology, implementing technology in every aspect of healthcare. But then there are countries which are a little later in that journey. So people who know, who read well, they know that there is a technology available for example, Artemis does a wonderful cyber knife for neurosurgeries, which is very, very instrumental in treating deep-seated brain tumors. Now, if that technology is never available in a country which does a neurosurgery, they would want to travel, these patients. When a better skill set is available externally, even the Indians are traveling. For example, somebody wants to get an intestinal transplant done, somebody wants to get a transplant of facial transplant done, they want to travel abroad because that is where in countries like US and UK and Germany, this technology is available. So when a patient knows that he needs something and a better technology is available outside, they will travel. So this is why a patient is traveling from one country to another in search of a medical treatment. But what is the larger picture? The larger picture is that our Honorable Prime Minister has committed to make India the global hub of healthcare. And I am talking of this in the context that why we need the people involved in travel business to consider medical travel also as a business vertical. Niti Aayog has committed a very large sum of money to grow India as a world healthcare hub. In the Union Budget in 26-27 announced in the February, our Finance Minister Nirmala Sitharaman announced a major push to establish India as a global medical tourism destination by supporting different states in setting up 5 regional medical tourism hubs. The leading private hospitals like Medanta or Artemis are undertaking expansion with more than 6,000 beds added in every fiscal year, and this was added last year, and a similar number or a higher pace is expected in the years to come. So we are adding beds every year, which gives us an extra capacity to treat the global patients, and we have an extra capacity to support the global need. India is bound to become a global hub, and that is without doubt. The question is, when it becomes the global hub, if we, the people involved in travel business, are part of that global phenomena. The size of the current medical value travel market is roughly around 4.5 billion. Am I right, Navneet ji? The projected market size by 2030 is 9 billion. Globally, it is expected to grow from 36 billion to 50 billion by that time. So this is where the market is, this is where the size of business exists, and this is where I am inviting all the travel people to join this phenomena called medical value travel. Now, for those who are not there, who have not started this business, the question is, how do we start? Where do we start from? What do we need to do? To ease out, to smoothen this question, I have come out with a very simple equation. And this is not something that I am doing it for first time. This has been there always, and it is also in the textbook of Symbiosis, which is a leading institute of management. They teach international business for healthcare, and this algorithm exists even in those textbooks. The number of patients for travel agent is number of customers. For number of patients, the equation is very simple. How many contact points you can generate? From those contact points, individually, how many queries can you generate? And once those queries have been generated, how can we work on the conversion rate? The larger the number of patients is, the bigger the business is. I'm going to come back to this equation. But let me first define the contact points. Divya, would you like to join me here and explain these contact points alongside me for some times?
Avik, thanks. I want you to go back to the previous slide first.
Sure.
Now, Avik's algorithm, we all go by this. Navneet sir, Manoj sir, let's have a look at the conversation. Number of contact points. Now let's stop here. A person traveling in India, traveling to India, sorry, how many contact points are there? Any rough guesses, audience? They may be profitable, they may be non-profitable. They may give you money, they may not give you money. Guess. How many? हिंदी में बताता हूँ, मैं नाइजीरिया से चल के भारत आता हूँ, मैं कितने लोगों से मिलता हूँ इलाज कराने के समय, 1 महीने के दिन, 1 महीने के अंदर अंदर. Guess.
So I think the answer lies in understanding, and most of them
Absolutely.
are still learning.
Absolutely. So we need to define this number of contact points. First contact point is the referral doctor sitting in Nigeria, for example. Next is the travel agent sitting there. Third person, the one who greets at the Indian Embassy or the Indian High Commission. Fourth person is the visa officer who grants the visa. Fifth person is the airline person. Sixth person is the immigration officer. Seventh, the contact person who is receiving there. Are they all going to make money?
No, absolutely not.
So probably, you know, till there is no incentivize, we'll not be able to, you know, scale up this business. That's point number one.
Yeah, thank you, Divya. When Divya is explaining those contact points, when they get experience and then they have the taste of how a person who has been in touch with them have benefited from their travel into India, at some point of time, they start referring patients to you. And that is the referral model. The doctors, the travel agents locally, the word of mouth, as Divya was saying, the immigration officer said, my friend got treated at Medanta Hospital, Artemis Hospital, you should go. He will tell it to his neighbor, to his family members, etc., etc. So that is the referral point. But that is only one vertical from where you can generate the contact points. The next contact point will be the information offices. So Artemis, Medanta, they all run, and there are a lot of hospitals in India, they have their information offices based in those countries from where the patient is coming. Some of the travel agents who are present here would be having their own offices in those countries, and which can then start promoting. So the information centers. Now the information center run in two ways. Either you can run an information center on behalf of a hospital, provided the hospital allows you to use their brand name and run it and sponsor you for doing that, or you can run your own information center there. Some of the medical value travel companies have their own information centers in countries like Uzbekistan, in Kenya, etc., from where the larger chunk of business comes. And this information center then becomes the contact point for a patient. Coming to the corporate model, lot of governments are sending their patients into India. They are also sending to other countries, but they are sending into India. So the government then becomes a contact point. Within the federal government, there will be a lot of county government, state government, who have their own individual, depending upon the country's healthcare structure. Somewhere the healthcare is governed by the federal government, somewhere it is governed by the state or county governments. So they become your contact point. There are insurance companies who are referring patients into India. So the insurance companies then become, or people there in the insurance company become the contact point. There are NGOs, and in countries like Tanzania or Uganda, they run programs called Harambe, where they pool in money to sponsor a patient who cannot afford a travel to other country to go and get treated. That's the corporate social responsibilities that they do. And then there are corporate, large petroleum companies, large airline companies, they become your contact points to get a patient. Last but not the least, to get the clock set in right, there is a digital model. So internet or cyberspace becomes a very large captive market where the patient is seeking an answer, and that large point becomes a contact point. So when we talk of ABIC's algorithm, that is the first part of it, that is called the contact point. Now coming to the query part of it, where there are multiple models to raise queries. And if I can request Manoj Bhai, if you can just go through the slide and explain what I am trying to say.
So like first model is digital model, which is in use nowadays. You do SEO, SMO, PPC, and then you do retargeting depending on the area, you know, from where you study the disease burden of that place, and accordingly you plan your marketing, digital marketing strategies, you know. So there some area where, like in Africa, you have incidences of bone marrow transplant, sickle cell anemia, and you have certain type of cancers in some of the region. So when you do digital marketing, you are focused only on those diseases so that you can get the maximum input to you. So that is one model. Then of course referral model is there, where you have outpatient clinic run by doctors, CMES. Then corporate model is there, which is I think not tapped that much as of now. Like in India, we do domestic marketing where we are targeting a lot of corporates, and you know, there is a team who is going and meeting those corporates and selling their ideas about healthcare, you know, and what kind of benefit these corporates can get from the hospitals. So this need to work in depth. And one more query generation area can be like insurance agents, you know, who are doing policies. So you educate them and tell them when they are selling the policies, they should talk about healthcare also, and you should give options for health policies also. Then information offices, as Abhik Bhai already explained, that you can do local marketing through your local network. You can hire people there who will do local marketing in those corporates, insurance companies and other stuff. So these are certain ways, you know, where we can do things. But this is a constant endeavor, you know, you have to keep on doing these things to maintain the continuity of the business.
Thank you, Manoj Bhai.
Right.
So as Manoj Bhai explained that there is a digital model, I don't need to tell you, but what we need to look into the digital model is that this will be slightly different, because this is a medical thing. People are looking for authenticated medical, and the previous panel was talking of evidence and evidence-based medicines, etc., etc. So when we are putting up our website, when we are putting up our content, it needs to be medically oriented. The selling point is not only the treatment. The selling point in here, the product is also your doctor. The product is also your hospital. The better you present them through your website, the better you do a search engine optimization based on the keywords of those particular specialties. So cardiac will have different keywords, the cancer will be different. Unlike a normal travel company where you holiday, relaxations, etc. are similar keywords. So it is a little more specific, a little more, and then you need to look at which country has which disease incidence rate, and then start promoting that particular treatment in that particular country. The referral model, when you have made partnership with a doctor, engage with him, say if my doctor from India can come there and run an outpatient clinic, we call it an OPD campaign, and we sit with that doctor, we advertise that OPD that a doctor from India is coming and he will be very happy to see the patients there, and that because of that Indianness into the outpatient clinic, we call it OPD campaign, a lot of patients then register, come and get the report shown to that doctor. The CMEs, or the continuous medical education, are lectures given by one doctor to other doctors. So the local partner can then engage other doctors, get them into a hotel or at a place where we can serve them dinner, etc., give them a lecture on a particular specialty. At the end of the day, you are only promoting your brand, you are only telling people that this is what we do. If you have a patient, you can send it to us and we will be very happy to treat them in India or wherever you want to send them. In the corporate, when I said that there are insurance companies, there are large corporates like the port authorities, etc., they would send their employees or patients to you only when they see and believe. So we make a small delegation of such people, we invite them to India and we showcase our hospitals, we make them meet with our doctors, so they are confident that they are sending their patients to the right place. So organizing such events, delegations like the event like this one, and Advantage Healthcare India, where we have invited so many delegates from outside for them to see and believe in what they are referring their patients to. The information centers, as Manoj Bhai rightly said, can go around, meet with the local doctors, try to tell them about your company, try to tell them about the hospitals that you are promoting, can also do local advertisement, for example, in newspapers, in TV, in radio, etc. That's the local advertisement. But one thing, as Manoj Bhai rightly said, that we need to be constantly in touch with our contacts. You cannot just make a contact and leave it, because you have to keep them reminding that this is what we do. In case you have the next patient, we will be very happy to assist them. So that constant, and then you need to support them by doing these kind of events, and you need to engage them by getting into an action on almost on a quarterly basis. Last part comes the conversion. When you are converting a query to a patient, a lot of things goes into converting when you receive a query from these places, and then you convert them into patient, from getting the medical report to the point where finally a patient has traveled, let's say to Medanta Hospital, where Navneet ji is. So Navneet ji, the conversion, we have to be quick in answering our queries. We have to be wonderfully well when we are medically and commercially to answer those queries. And we have to be as explicit as possible, give them as many details as possible. So would you like to highlight your thoughts on how, from a query to a patient, what all is needed to convert that patient?
Namaste. Assalamu alaikum salam. See, I have just been added into this stuff. So you must have noticed I have had 8 elements to be in a position to talk on something. But I think Abhik has already explained most of the things, how this thing works, because I don't even know. I think the topic is what is the role of Indian travel companies or any travel companies in bringing more patients and developing the market globally. So I don't even know how many are actually travel agents here. Is there any travel agent? Sadarji, again, though, I think so we have 2 or 3 people who are actually travel agents. But what Abhik has explained, or what Manoj Bhai or my brother Shah has explained, what Abhik was explaining, I think he has explained from A to Z everything. I was feeling I am a student and Abhik is a professor of Medical Value Travel College, and I'm learning everything from A, and I think we have reached Z or X somewhere. So it was good talk he has given. I think most of you have understood, who are not in this trade, who want to take this as a business profession. It is, first of all, we have to understand that medical value travel is a healthcare business, and here it is, money is secondary, revenue is secondary, it is patient first. Unless everyone has this thing, this concept clear in their minds, that we have to give the best care to our incoming patients. Whether they are Indian patients, whether they are coming from any country, patient hai. We have to look after them, we have to give them the best care. And India is known for providing affordable care, affordable quality care to our patients. So that is one topic. I would just like to add what Abhik has already explained, how the MVT industry works. Now, as far as the query, the question that he has asked me, what did he say? Query to conversion. Now, query to conversion is basically, there are two parties involved. One is the hospital where the query has landed, and one is the company which has sent the query. It could be from a travel agency, or it could be from anyone, XYZ, or from a hospital in the other country. That is immaterial. But there are two parties involved, the sender and the guy who has received it. So the first objective of a hospital, which I have always, or we in fact, have always been trying to advocate, is that the queries should be answered within 4 to 12 hours, unless it is a multi-specialty problem query, which may take little time. So we should, our teams are developed normally to, if it is a basic query, ki cardiac hai, bypass surgery hai, triple vessel disease hai, there are few things which are very simple and well explained by the sender in the query. Like we get queries from Abhik, most of the time his company, his staff is well trained. They send us queries which are very elaborate and well explained, so the answering becomes very easy. Magar agar query is not very well explained, you have to go to the doctor to understand what it is all about. Doctors are also not sitting idle, so you have to be after them and make a complete reply of duration of stay, risk involved, approximate package and everything, so that one sheet answers everything and sends it back to the sender. And then your role does not end over here. You have to continuously follow up with the sender. Again, I am repeating, the sender can be a hospital, a private patient directly, a company like a Abhi's company, or a travel agency, or anyone, or the government or insurance company. Irrespective, the sender, we have to follow up with the sender and chase them, in fact, ask them what is the problem. If they want us to do a con call or a video call with the doctor and the patient, sometime it is required to give them more confidence. We have to organize it. The hospital has to do all this role. The sender's role is to see if there is a problem with the pricing, महंगा hai, he wants some discount, he has to come back to us, and the conversion takes place with a joint effort from both the sides. Because we have to understand, a person has to travel all the way and come to a different country. We have to give him assurance, we have to give him the confidence that he won't be cheated, he will be well looked after. Language is a barrier, that is the biggest barrier. With my experience of 40 years in healthcare, religion is never a barrier. Food is never a barrier. It is the bhasha, the language, which actually handicaps a person when he travels to a foreign country. Even when I travel or you travel, language is important. So we, the translators, the interpreters, the people in the team have to be very well trained, and they have to work together with the management and the agency to give confidence to the patient. Only then the query will be converted and patient will arrive.
Thank you, sir. As Navneet rightly said and perfectly said, it is all summarized in the slide in front of you, that when we are answering the queries, one has to be very, very quick. Our turnaround times have to be fast enough. 12 hours is the best, or at least within 24 hours. Be clinically good. You need to do the diagnosis. You need to tell the diagnosis to the patient that this is what we are going to do. You have to tell the treatment plan of what the treatment plan is, what are the investigations that are required, and I'm going to show you a sample in the slides to come. You have to be simple, yet you have to be technical. So the language that you use while answering that query can make the difference in the conversion rates. Add a bit of extra information, because do not expect that patients to know everything about India. He doesn't. He doesn't even know that what will happen before the surgery, after the surgery, etc. So you need to answer our queries with that extra bit of information. We need to add the freebies, which gives them confidence. For example, as Namreetji said, a video consult, attendant services in language specific. If the query is from Middle East, he speaks Arabic, then the attendant services has to be in Arabic. If somebody is from Russia or speaks Russian, then accordingly we need to change our attendant services. I'm going to give you a sample in times to come. This is a sample opinion, the way we answer. And why we have put this sample opinion in front of you is because this is where the crux of the matter is. While the industry runs at an average query conversion rate of 5%, for HBG, the average query conversion rate is 22%. So out of every 100 queries that we are answering, we are getting 22 patients. So the queries is less, the effort is less, but because the way we are answering queries, there are more patients. If you can see, the first thing that we do after the greetings is we write down the findings. On this particular neurosurgery case, the finding says that blah, 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 this patient has been suffering with a glioma, etc. And then we explain what the particular problem is. Then we write down what are the evaluations that are required to confirm that diagnosis. Why we write this? because at times when we receive a report, it does not mean that it is 100% accurate. There are more chances than when the patient comes here, we might find a comorbidity, which means he might have an extra problem, or he may have a totally different problem. So we need to confirm that diagnosis by doing evaluations such as MRI, CT scan, etc., etc. And then we write the possible treatment plan. In this case, the possible treatment plan, because it's a brain tumor, it is craniotomy, and we are explaining how that happens, because we have to understand this is read by a patient who is not medically trained. If we simply write he needs craniotomy and we don't explain how that procedure happens, he will probably go to somebody who is able to explain him better. We also write, as I said, that we have to add extra information in this place. We have written how many days he needs to stay in India, and we have explained it, how many days in hospital, how many days outside, because he's also, based on this information, he's planning his budgets. Then, as a neutral agency for the hospital, they will only talk about the hospital, but as travel agents or medical travel agents, you have the liberty of giving them options. Options at different price point, options in different cities, options of different hospitals, etc., etc. Why do we do it? We allow the patient to choose. That is the biggest thing. Because if we are giving them only one or two options, we are pushing our choices down their throat. But here, we are allowing the patient to choose. So that if something, by chance, there are 1% of chances where things might not go well, then you always have a fallback option. We gave you options and you chose this option for yourself. So that is the fallback plan for anything that might go wrong. So give them options, let them choose, let them be informed. In this particular options that you see, you have the name of a hospital and then there is a link. So one can click on that link, read about the entire hospital, what are the specialties of that hospital, etc., etc. Then there is the next link, which is about the gallery. Everybody, when we are traveling, we also want to see what kind of hotel this is. We also want to see is there a pool, is there a way to bridge, etc., etc. So we then put a link which has a gallery which shows the hospital photographs, the photographs of places nearby, etc., etc., so that a patient can make an informed decision. Then we add the link of a doctor who is going to treat, because it becomes important. Every doctor is a good doctor. We cannot say that this doctor is not good and this doctor is very, very good. So we let the patient decide. In this particular profile, you write down what are the qualifications of that doctor, what is the experience, how many surgeries, what is the specialization, etc., etc. So this is the kind of choices you give them so that they can make informed choices. Then you give them the prices. In those hospitals, what will be the prices? So for example, a Mumbai, a pricing might be different. So Mumbai is slightly more expensive than Delhi is. Delhi, for two different prices, depending upon what kind of a hospital that is, there can be a price differential. And when somebody asks you why this is expensive and this is not expensive, you should have enough reasoning to tell them that this is slightly higher price because of XYZ reason. The doctor may be very, very experienced. The hospital may be out of the world. The technology that they use is wonderful, etc., etc. So there will always be, for example, there is a 5-star hotel that you sell. Then there is a 4-star hotel that you sell. There is a 3-star hotel that you sell. And with every star, the extra facilities go up and down. The same reasoning can be given here. There can be some hospitals which are very, very good. And accordingly, the prices change. Then you give the inclusions. Because a price for what? What are we charging him for? So then you give the inclusions, make it as elaborate as possible, treatment charges, doctor charges, hospital bed charges. Make sure he doesn't come back to you and say, you said $7,000, where is my hotel accommodation? I will only stay in 5-star hotel. No, that doesn't include, because that is why it is important to say when we are quoting a price, what is the included. In the next slide, you must mention what are the exclusions. So what is not excluded? Somebody coming in for craniotomy, say, I also have malaria, please treat my malaria in the same price. Not possible.
So we need to always write what is not included. Then, as I said, we need to add extra information. What can he expect upon arrival? Who is going to receive him? Where he is going to get received at? Are we sending an extra car, etc., to receive them? And then give them a budget for an accommodation. Are we giving him a visa service? Are we going to help them with visas, etc., etc.? We need to mention them. So the more elaborate your query answer is, the better conversion rate comes. Coming back to the algorithm, which is almost the last part of my presentation, is like number of patients, number of contact point, multiplied by number of queries, multiplied by conversion rate. Giving you an example, if you have 100 contact points, and each of these 100 contact point is giving you 10 queries, you are receiving 1,000 queries in a month. And if your conversion rate is 5%, from 1,000, 5% is 50 patients. So every month you're going to do 50 patients. So if we work through this algorithm, the business becomes very, very simplified. And when we want to increase our business, we see where our strength lies. If our strength is in making more contact points, make this 100 a 200 and the number of patients double. If you think your strength is into conversion rate, you can change 5% conversion rate into a 25% conversion rate, work on that. If you think I have 100, I cannot make it better than 5%, from those 100 points, how can you generate more than 10 queries? So it's simply a retail business. If you are going to give inputs into those contacts, your number of queries are going to go up. Organize an OPD, organize a community talk, organize a CME, and your queries keep going up. So the larger the number of patient is, the bigger your business is. What can we sell? We can sell modern medicine and surgeries, wellness and well-being, as the previous panel was saying. We can definitely sell Ayurveda. A lot of patients come in for Ayurveda. Dental and ophthalmology, it is always a neglected product, but trust me, if you have tourists who are coming for, trust me, 1 out of every 10 tourists needs a dental surgery. 1 out of every 10 tourists will be having a specs which can be removed with a laser surgery. So out of already the business that you're doing, if you are able to convert those people into patients, you're already in business. Cosmetic surgeries, those people who are handling the Japanese people, they are very, very gung-ho about Indian cosmetic surgeries. So travel people who are involved in entertaining those tourists, you already are sitting on that particular business. Apart from that, definitely the tickets, the visas, your routine stuff that you can do for them. Where and how do we start? It is very, very important. Choose your market entry model. I have already shown you 4 models on which market you choose your market very, very well. Yeah. Put the right team in place. It is very, very important. Have at least one medico in the team who can tell you if you are medically right or wrong. There are a lot of dental doctors available, physiotherapist doctors available, MBBS doctors who have done their MBBS from outside India are available to join the marketing team or the sales team. Make some hospital agreements. There are hospitals sitting right on their dais who will be very happy to do an agreement with you. Start with multi-speciality hospitals so that you don't have to spread yourself too thin. What else can I add? It will largely depend on what the next question comes from you. With this, my presentation ends. Thank you. Questions, please. Yes, please. Can we give the mic?
Hello. I am Dr. Sadhna Srivastava. I am the senior scientist retired from Indian Council of Medical Research. And my responsibility at the time when I was in ICMR to introduce the new health products as well in India, not only India, in other countries also. So during this time, I came across about the medical tourism, medical travel value. And then by listening your deliberation, I understand that it is that you are going to treat the patient which are situated outside and based on the disease burden in the least developed country. And I came to know that then they are transferring to this and they are coming to the country, to our country for the treatment. You have spoken and experts have told about the travel agent. That this is a kind of the treatment because I am the part of the public health and I have to see the patients which belongs to the poor country, poor that they are not able to take the treatment cost. So that what is the difference in the travel agent or medical travel agent, because they are get kind of the training, one thing, and the other one that you have mentioned about the list of the physician, they will treat the patients which are coming outside. So that kind of the information we can get from the other sources also. So that is the platter you will provide and the patient will choose that these are the physician and they wanted to get the treatment from these physicians or the surgeons. Number two. And number three, that how you are rating the facilities of the accommodation, the travel, and how you are rating the physician and surgeons based on the treatment and based on the capability and the skill of the physician.
Thank you, ma'am. We understood your question. The medical travel business or travel business is actually a bridge between one who is seeking and one who is providing. So the job of a travel agent or medical travel agent is to provide that bridge. That's the first thing. We don't rate hospitals or doctors. For us, each and every hospital is a good hospital. That is why they are into international business. Every doctor is a superlative doctor. So we don't make that choices. We don't make that ranking. So when we are putting up 1, 2, 3, 4, 5, these are simply listing and it is not a ranking. When the patient is coming from the poor countries to a country like us, that statement may not be entirely true. That is because patients from developed countries are also coming to us. Manoj bhai, would you like to explain a little more when the patients from developed countries like from US, UK, etc. are also coming to surgeries in India?
So this phenomena is picking up now, and last 1 year we have seen good inflow of patients from developed countries. We need to create more awareness to get them here. As such, the image of India as a country is getting better and better. People are acknowledging us in healthcare sector, and they understand, because a lot of Indian doctors are working in a lot of countries and they are touching their lives there on daily basis. So one thing, which they feel that, okay, the Indian doctors are best, but they don't expect that same kind of facilities which they're getting there maybe are available in India. So that area we need to work on, and we have to create that kind of awareness that whatever treatment they're getting there can be given here at a fraction of cost. Cost is again one factor which is going to attract many patients considering the situation worldwide now, and a lot of waiting for people in their own countries. Canada, I was reading in newspaper that they don't have time for surgeries as simple as joint replacement, and forget about oncology treatment, other stuff. A lot of people, they develop into serious diseases because they're not treated on time. So I mean, few areas which we need to collectively think and work on.
Thank you, sir. So, madam, to answer your question, there are people from developing countries, less developed countries traveling, but there are people from fairly developed countries and very developed countries also traveling. Next question, kindly. Mike, please.
Thank you for this wonderful workshop. This is Dr. Osama Al-Mashadani from Iraq, Mosul, from Al-Hayat International Hospital. I would like to thank the Indians for treating our patients for the last 20 years. One of the patients, my father, he did surgery, cabbage, about 12 or 13 years ago with wonderful experience. I think the journey of the patient is not end by doing surgery to return to his country. There is another aspect. The other aspect is the follow-up of the patient. Some of our patients have difficulties with contacting their doctors and their hospitals. And sometimes the intervention, the surgery that is done in India need a long-term follow-up. Like, I am a president of Nineveh University. One of my important employee in the university.
Sir, if I may request you to keep your question short because we are running.
He did surgery here by implanting something in the brain to treat Parkinsonism. This need programs. He and maintenance. Now he have a very big problem in Iraq because he can't return to India, and there is nobody doing this program perfectly in Iraq.
Thank you, sir.
Thank you very
Navneet ji, would you like to take this question? Complicated treatment like
I'll give you
Parkinsonism and the follow-up.
yeah, I know the time is short, so I'll give you a quick answer, sir. You yourself said your father was operated, everything went well. See, we have to understand it is medical sciences ultimately. Treatments are given. In a hospital, we all want the patient should go back with a smile and on his own feet. We don't want anything to be spoiled. But yes, sometimes it does happen. A complication arises. We always want, wherever this patient is, please let us know, whichever hospital he is in, we will all take care of him. And whatever is required, the best will be done again. Sometimes it does happen. It happens not only in an international patient, it can happen with Indian patients also, a domestic patient also. Problems do occur sometimes, but the doctors are there, the hospital is there to solve it. So we assure you, sir, whosoever is this patient, wherever this patient is, we will take care of the patient. Please let us know. But this should not be disheartening. This should not be a reason we will not be able to send more patients or patients cannot travel. International travel or it is domestic, problem can happen everywhere and we are willing to solve it.
Thank you, sir. Next
So
question.
one point I would like to add here in continuation of this answer. We can have a collaborative approach to train doctors in countries from where the patients are coming to India, you know. So that training program can help for follow-ups, which is very critical in a lot of cases where infection occurs. So at times, you know, infections spread very quickly and it is difficult to treat patient locally. So of course we should look at these programs, and I think already some work is progressing in these areas. Government of India is taking some initiative so that, you know, we can do this on a fast track basis.
Thank you, Manoj bhai.
And we get doctors who come and learn from most of these hospitals. I don't know, but Iraq is the only country from where we get very less patients for training purposes. We provide free training. At least in Medanta it is free.
Less doctors.
Less doctors who want to come here and learn from us. It is very important that there should be a scientific exchange. See, we are here not only because we want to discuss business, you send patients, we take care of it. It is not only that. Idea is that India is a pioneer. We want to develop healthcare in your country also. That can happen only when you also take initiative, send doctors, send paramedical staff to us, learn from us. We have volume, we will teach them. We will not charge them. Let them learn and go back, and they become the ambassadors also, and they give the backup care to the patient when he returns back to your country. So as Manoj rightly said, take initiative, send them. This is the proper?
Sure. Thank you, sir. We can have this discussion offline later. Next question, please.
I am Manmeet Singh, sir, Director Sky Tours and Travel. First of all, I like to have a agreement with the. With
sir, ho gaya agreement, ho gaya. Kagat deo more lao, ho gaya agreement.
Right, sir. Thanks a lot. And one thing more, like if it's a kind of marketing when we approach our clients in foreign land to bring them to a country. So normally the hospitals are very busy with their schedules, and at times when we bring someone, they'll expect some kind of a more courtesies, as sir was saying, in a fee basis or something, that more attention is given to those clients. Because if we see, we have a police, but we have a tourist police specifically, because they are more empathetic and they understand what exactly is the need of the tourist. So likewise, when we have that tie-up, we would expect that kind of an leverage from your kind self.
Sir, you don't have to worry. Really, I'm telling you.
Thank you.
Bilkul. See, India is a medical hub today. As Avik has told you, we are the best. We are not number two. India is the place. We have overtaken most of the countries as far as the quality affordable healthcare is concerned. ਇਹ ਧਿਆਨ ਰੱਖਣਾ ਤੁਸੀਂ ਟਾਈ ਅਪ ਕਰੋ, ਤੁਹਾਨੂੰ ਘਰੋਂ ਚੁੱਕ ਕੇ ਲੈ ਆਵਾਂਗੇ ਮਰੀਜ਼ ਨੂੰ, ਹੋਰ ਦੱਸੋ ਕੀ ਚਾਹੀਦਾ ਤੁਹਾਨੂੰ?
Thank you.
ਰੋਟੀ ਛੋਟੀ ਸਭ ਕੁਝ ਮਿਲੇਗਾ ਜੋ ਉਹਦਾ ਟੇਸਟ ਹੈ, ਕੀ ਦਿੱਕਤ ਹੈ? ਕਰੋ ਕੰਮ.
And sir, most of the hospital have their own international teams which are trained to handle international patients. So you need to get in touch with the international team.
ਤੁਸੀਂ ਦੇਖੋ ਟਰੈਵਲ ਏਜੰਟ ਹੋ, ਤੁਹਾਨੂੰ ਇੱਕ ਗੱਲ ਦੱਸ ਦੇਣਾ. Only difference where we started this topic, I want to summarize one line. There is no difference between a travel agency selling holiday packages or flight tickets or selling a healthcare. Idea is product changes. Even if you have to start selling packages for Thailand, ਤੁਸੀਂ ਜਾਓਗੇ ਉੱਥੇ ਦੇਖੋਗੇ, ਹੋਟਲਾਂ ਨਾਲ ਗੱਲ ਕਰੋਗੇ, you will try to understand what is the airline ticket package, ਇਹ ਸਾਰਾ ਕਰੋਗੇ ਤਾਂ ਹੀ ਲੋਕਾਂ ਨੂੰ ਪੈਕੇਜ ਦਿਓਗੇ ਨਾ. ਇੱਦਾਂ ਹੀ for selling medical value travel, you have to visit the hospitals. ਵੈਬਸਾਈਟ ਤੇ ਦੇਖਣ ਨਾਲ ਨਹੀਂ ਪਤਾ ਲੱਗਦਾ. ਵੈਬਸਾਈਟ ਤੇ ਮੈਂ ਲਿਖ ਦਾਂਗਾ ਮੈਂ ਸਭ ਤੋਂ ਬੈਸਟ ਹਾਂ, ਹੋਵਾਂ ਫੁੱਦੂ, ਤੁਹਾਨੂੰ ਕੀ ਪਤਾ? ਤੁਸੀਂ ਆਓ ਸਰ, ਦੇਖੋ ਸਾਰੇ ਹਸਪਤਾਲ ਬੈਠੇ ਨੇ, ਤੁਸੀਂ ਗੱਲ ਕਰੋ, ਪ੍ਰੋਡਕਟ ਦੇਖੋ, ਪ੍ਰੋਡਕਟ ਸਮਝੋ. ਪ੍ਰੋਡਕਟ ਸਮਝੋਗੇ ਤਾਂ ਤੁਸੀਂ ਵੇਚੋਗੇ ਨਾ ਸਰ ਜੀ. Sorry, I'm talking in Punjabi. You have to learn Punjabi in 4-5 days. Because the way you abuse in Punjabi, wallah, you will never enjoy.
Thank you. Do we have time for another question now? No. So we need to close down this session now. For any further questions, all the three of them and the fourth one is me, we are all available here. You can catch us anytime. Thank you so much for the lovely audience that you have given us. We are very, very thankful to you. Thank you, dear panelists, Navneet Saab, Manoj Bhai, Divya Shah. Thank you so much for being your presence.
What a fantastic session that we just witnessed. Let's have a huge round of applause, ladies and gentlemen, for all our speakers. And I would like to invite on stage Mr. Ishan Pandita, Director FICCI, to please present the mementos to our speakers. Can we have the memento, please? Starting off with Mr. Abhik Moitra, President and Managing Director, HBG Medical Assistance. Mr. Navneet Malhotra, let's have a huge round of applause. To Mr. Abhik Moitra, let's keep the applause going. To Dr. Manoj Kumar, to Mr. Divya Shah, I request all our speakers to please step ahead for a group photograph along with Mr. Ishan. So ladies and gentlemen, with that you were witnessing the workshop session subjected around from travel to medical value travel, the role of Indian travel companies in positioning India as a global healthcare destination. A huge thank you to our speakers for the fantastic session and the fantastic moderation. With that, we'll now be starting off with a very prestigious segment of today's conference, but we'll just take a moment to set the stage up. I would request all of you to please stay put with us as we are about to start with a very prestigious segment of the 8th edition of AHCI 2026. It's going to be the strategic MOU signing ceremony, ladies and gentlemen. It's going to be very, very prestigious segment of the conference. So I would request all of you to please stay put with us. Thank you. ऑन कर दीजिएगा मैम ऑन करके All right, ladies and gentlemen, I would request everyone to please take your seats. Requesting our lovely audience to please take your seats as we are about to start with the strategic MOU signing ceremony, ladies and gentlemen. Ladies and gentlemen, facilitating institutional partnerships, international collaborations, hospital alliances, Ayush collaborations, and cross-border healthcare partnerships to strengthen India's position as a leading global healthcare and MVT hub. Ladies and gentlemen, let me tell you that during the AHCI between yesterday and today, many B2B meetings between Indian companies and foreign delegates were facilitated, and a lot of Indian companies have signed the MOUs with the foreign companies, and we would like to invite and congratulate them on this global stage. Ladies and gentlemen, as we start off, it is my absolute pleasure to invite on the stage our very first It is my absolute pleasure to invite on the stage our very first MOU that is going to be signed between Apollo Hospitals, and I would like to invite Apollo Hospitals to declare the MOU signed by you along with your partner for a photo op. Please join us, sir. Many congratulations. And we have the mic in place. I would request you to please invite your partner one at a time.
Very good morning. This is a MOU signing ceremony that FICCI has organized. I'm so much thankful to this joint collaboration. So I am sure that this MOU is going to take a long way in our medical value travel relationship with our partners. I would request Mr. Samrat of Medi Support to reach the dais to exchange the MOU with us. Mr. Samrat? Okay. Mr. Samrat, are you here somewhere?
Can I request Mr. Samrat to please join us on the stage for the MOU signing with Apollo Hospitals?
Okay. I would request Mr. Dheeraj of Mid Support from Bangladesh. I'm extremely sorry. I think they're occupied somewhere in the meetings, I think. But I have Mr. This MedLab. Yeah, I think he's here.
Can I please request Medilab team to join us on the stage?
Yeah, please come. MedLab is a very reliable partner with whom Apollo Hospitals have been working for a very long time, and we'll be extending our all cooperation and in terms of patient referrals, trainings, capacity building, and all those kind of verticals. That's a part and parcel of MVT. I request you to say some few words about the relationship.
Assalamu alaikum. I am from Bangladesh. My organization name is MedLab. We are very much happy to join here, and thank you Apollo, Mr. Guruji, to give me a chance to work with him. हिंदी में बात करने से कोई ओके है ना?
Absolutely.
मेडिकल टूरिज्म के लिए मैंने बांग्लादेश से 9 years के लिए काम कर रहा हूँ इधर पे. So Apollo is the most popular hospital in Bangladesh. कभी भी बांग्लादेश का जो बंदा लोग पासपोर्ट बनाता है ना, वो 90% बनाता है इंडिया आने के लिए. तो इंडिया का नाम लेने से पहले ही आता है अपोलो का नाम है. सो मैं खुद को बहुत खुशनसीब मानता हूँ जो क्योंकि अपोलो को साथ जुड़ने का मौका मिला है. सो थैंक यू सर, थैंक यू, गिव मी द चांस, थैंक यू.
Fantastic. I request MedLab and Apollo Hospitals team to please join us on the stage. Step ahead for a photo op. Let's have a huge round of applause, ladies and gentlemen, as we are signing the MOU between Apollo Hospitals and MedLab from Bangladesh.
Next, I request one of our Nigerian partner, Florence John Health, I think from Nigeria. So we have requested you here. Yes,
Can I please request
she's there.
Florence team to please join us on the stage for MOU signing?
Yeah, she's Olubasulu.
All the way from Nigeria. Let's have a huge round of applause as we welcome her on the stage. And we'll now be signing the MOU between Apollo Hospitals and Florence.
Yeah, see, Olubasulu, it's a kind of a confidence that we are rebuilding the relation. Whatever has been committed in the during our discussions, we'll take it forward. It's a formal kind of an agreement. We're just signing, and the photos will go online. Okay? Thank you.
Let's take a quick photo op. Many congratulations.
Okay. I'll send you a copy of this later.
Okay,
sure.
thank you.
Thank you.
Thank you. With that, I would request sir to please move up to the next partner.
Yeah, we have one more WeCare Healthcare, again from Bangladesh, Mr. WeCare from Myanmar. Do we have you here? Sai Ram? I'm not sure he's here. I think we will go to the last one, which is Anisa International, Mr. Huck.
Can we have Anisa International team to please join us on the stage?
Yeah, he's here.
Let's have a huge round of applause, ladies and gentlemen, as we have the Anisa International team joining us for the MOU signing between Apollo Hospitals and Anisa International.
Thank you, Guruji, and it is a prestigious moment for us that I am signing agreement with Apollo Chennai and Apollo Group, and it is the #1 popular and most renowned hospital in India and also in Bangladesh. Thank you so much.
Many congratulations.
Yeah,
I would just request you to please step up for a photo op. Many, many congratulations as we sign the MOU.
Thank you all. I mean, we have done this MOU, and we thanks the entire audience and Fiki for organizing this MOU. Thank you.
Thank you so much, sir. Thank you, Apollo Hospitals. Yeah. And with that, we will now move on to our next MOU, and I would like to invite on the stage Medanta Hospitals. Can I please request Medanta Hospitals to join us on the stage and declare the MOUs between your partner?
Hello everyone, I'm back again with my standard bullshit, but this time it is something very, very serious. Where is my business partner? Kahan gayi, madam? Ma'am, please come. See, Fiki has always given us a platform for which we are thankful to Ishan, Jishan and the entire team. Madam, to you also. But they have always given us a good platform where we are able to meet new people, new partners. That is the whole idea of this event. And to be very honest, we have so far had a very fruitful business meeting like most of the hospitals here. And we have signed 7 new contracts, but like Apollo, I would not like to call them on the dais. Neither would I like to share their names because this is pure business. My partners remain my. So, ma'am, she is 100% ours, so I have called her on the stage. Okay? Thank you. Thank you, ma'am.
Many congratulations. Can I request you? Nothing more.
We are the best.
Okay, thank you very much. My name is Diana from Rwanda. I'm very happy to work with Medanta. It's a best hospital in India. So thank you for the trust.
ये सब अपोलो वालों को नहीं आता गुरु सीख ले बाबू.
All right. Can I please request Mr. Navneet and, of course, their partner to please step ahead for a group photo? Many congratulations.
Thank you.
Many congratulations. Thank you, Medanta. With that, now I would like to invite Yashoda Hospitals on the stage. We have Dr. Jyoti Kaur with us from Yashoda Hospital, and welcome, ma'am. I would like to request you to please declare your partners one at a time.
Thank you so much. We have nothing to hide. So that's what, and thank you Ishan, Jishan and the whole FICCI team to having this Advantage Healthcare every year, year on year. I still remember when we started it together when I was in SAPC, way back 2015, and till date it's continuing to its glory and adding on year. So we are very, very happy to be here, and we have had some quality meetings. We're happy to see the quality of the buyers, which have been here from many countries. And every year we see the countries are increasing. So first partner I would like to call on stage is Ms. Uritz from UHGC Mozambique. Please, if you could come on stage.
Let's have a huge round of applause, ladies and gentlemen, as we welcome Madam on the stage.
Thank you, Uritz. Please, I would like you to say a few lines.
Good morning, Mr. Uritz from UHGC, Mozambique. This is my first, when I came to India, I did a partnership with the Yashoda Hospital, and Mrs. Jyoti is behind of me all the way until now. Thank you very much.
Many congratulations.
Thank you, dear.
Let's have a photo. Thank you. Thank you, madam. With that, I would now request Dr. Jyoti to please invite our next partner.
Carmel Group, Mr. Deepak from Kyrgyzstan. Is he here?
Can we have Carbon Group to please join us on the stage?
Carmel Corporation, Kyrgyzstan, Mr. Deepak Joshi. Is he here? Or Mr. Kumar? All right, they must be busy with the meetings. Mr. Yunus from GTS Oman. Mr. Yunus from GTS Oman. Please, can you come on stage? Mr. Yunus, are you here? Do we have Hospital Regional Tambaconda from Senegal? Mr. Sheikh Dram. Mr. Sheikh Dram from Senegal. Are you here, please? Mr. Sheikh Dram from Senegal. Miss Merlin Yu from Indonesia. Miss Merlin Yu, she was at the B2B meetings last when I saw her. Yeah. Come. So I'd like to invite Miss Merlin Yu from Indonesia, from Live in Well Care, Healthcare.
Let's have a huge round of applause, ladies and gentlemen, as we welcome Miss Merlin on the stage. Hi. And we'll be signing the MOU between Live in Healthcare and Yashoda Hospitals.
Please say a few lines. Okay. Hi, everyone. So sorry I was late. I was around. So good day to everyone. My name is Merlin. I'm from Indonesia. I'm the CEO founder of Live in Well Care. We are a medical tourism company. We have worked with 13 countries. In India is one of them. And of course, I would like to thank you, Miss Jyoti, today. She has been a good friend as well. And of course, today we are formally working with Yashoda. Thank you so much.
Thank you, Vicky, once again for the platform.
I request both the parties to please stand for a photo op. Let's have a huge round of applause, ladies and gentlemen, and many congratulations to both the parties.
Thank you, Merlin. Thank you.
Thank you.
I still need to continue. So, now, if I may call from Florence John Health, Nigeria. Florence John Health, Nigeria. So in total, we have about 9 MOUs. Welcome, ma'am.
Thank you for the opportunity. I'm standing here for my CEO. I think he's just gone out there to sign his delegate card to make sure he receives the stand. But I'm here to stand in for him.
We'll now do the photo op between Florence and Yashoda Hospitals. Many congratulations.
So once again, I would like to call Hospital Regional from Senegal if they are here. Mr. Sheikh Dream, are you here? Mr. Yunus from GTS Oman. Mr. Yunus from GTS Oman. The Carmel Corporation, Kyrgyzstan. Oh, Yunus is here. Yes.
So we have Mr. Yunus from Oman. Many congratulations, sir.
Welcome. So we got a platform here, though we knew each other for years, to come together again in a new way, please.
I would request both the parties to sign.
Hi, my name is Yunus. I'm the CEO of Global Treatment Services. So we are signing this MOU for collaborating for capacity building program and visiting consult program and Ministry of Health business.
Many congratulations.
Thank you, Yunus.
I request both the parties to please stand for a photo op. Thank you. Many congratulations to both the parties.
Again, Mr. Deepak Joshi, are you here from Carmel Corporation, Kyrgyzstan?
Is all of them are done?
No.
can then take it later because we have others also.
Okay, okay, yeah. Mr. Ganbold, are you here? From Alton, Safar. Mr. Ganbold.
Do we have the Alton Suffer team here?
All right. Mr. Cole from Matrix. Mr. Cole from Matrix, are you here?
Can we please have Mr. Cole from Matrix?
I think we've already signed, so maybe they're busy with the other B2Bs. Thank you so much.
Thank you so much, Dr. Jyoti. With that, we'll now move on to the next one. And I would like to invite on the stage Balaji Dental Clinic along with their partners. Can we request the Balaji Dental Clinic team to please join us on the stage? And please declare your partners one at a time. Over to you, madam. I would request you to please invite your partners one at a time.
Yeah, first I would like to thank all of you for bringing dental into highlight this time. Last time I said it is medical value tourism, which has always been in lights, but now I feel like dental value tourism will come into picture. And thank you, Jishan, Ishan, and everyone, the FICCI team, for giving me this opportunity. Now I'm calling my team, my partners, Egypt in Touch assistants, Dr. Ahmed and Dr. Rami, who has signed an MOU with us. Dr. Rami, Dr. Imad.
Let's have a huge round of applause as we welcome them on the stage. I request both the parties to please stand for a photo op. Many congratulations. Thank you.
Dr. Lamola from Republic of Congo. Dr. Lamola.
We can move up to the next if they are not here. YC sir joining us.
And Florence John Consultancy. Yeah, both of them can come together.
Welcome, sir. Many congratulations. I also request the Florence team to please join us. Thank you.
Again, the Florence people, they are very much helpful and they have signed an MOU too.
So with that, we are signing the MOU between Balaji Dental Clinic and Florence. Many, Florence John, many congratulations to Florence John and Balaji Dental Clinic. Thank you.
Last but not the least, I would like to call Anisha people from Bangladesh. They have always been a support to us.
Many congratulations, sir. Let's do a photo op. Many congratulations to both the parties. Thank you so much.
Thank you everyone for sparing time. Thank you.
Thank you, Balaji Dental Clinic. With that, we now move on to our next one. It's going to be Paras Hospitals. Can I request Paras Hospitals to join us on the stage? Welcome, sir. Sir, I would request you to please declare your partners one at a time.
Sure. So good afternoon, everyone. So we have not signed so many MOUs, but we have built up too many relationships and trust. So to start with, I would like to call Mr. Salion Tall from Senegal to start with.
Many congratulations. Let's have a huge round of applause as we welcome Sir on the stage.
So Mr. Salian is from West African Association of Medical Assist from Senegal.
Good morning, all. Thank you to give me this opportunity. My name is Saliou Tal from Senegal. I am a former director of hospital and CEO of agency working in medical tourism. Thank you very much.
I request both the parties to please stand for a photo op. Many congratulations. Thank you, sir. With that, I would now request you to please invite and declare your next partner.
So second partner is SES Unisure Insurance from Zambia, Dr. Noura and Dr. Dula.
Very warm welcome.
Your insurance?
So my name is Dr. Ndulo. I'm Chief Medical Officer at a medical insurance company in Zambia. So we offer international insurance and we're happy to be signing MOUs with hospitals in India.
I now request both the parties to please stand for a photo op. Towards the center of the stage. Thank you. Many congratulations to both the parties.
So the last one, but not the least, Mr. Sufyan from SK Med Global, Algeria.
Very warm welcome to you, sir.
Okay, hello everyone. Good morning. Bonjour. Assalamu alaikum. So I'm Sofian from Algeria. I'm having a medical tourism company and we're referring patients here to India. So I want to thank Fiki for organizing this Advantage Healthcare events and give us the chance to build a high relationship with the stronger partners. Thank you.
Many congratulations, sir. Let's have a photo op. Thank you. Thank you, Paris Hospitals. So with that, we would now like to invite on the stage Artemis Hospitals. Can I please request Artemis Hospitals to join us on the stage? Let's welcome Artemis Hospitals. Hello, sir. With that, I would now hand over to Artemis Hospitals team to please declare their partners one at a time. Over to you, sir.
Namaskar everyone. We, the team Artemis Hospitals, want to thank Team FICCI and also all the partner hospitals, all the delegates, all the medical value travel companies who have come up, taken this much of effort. And to begin with, I would like to call Mr. Peter Mana, Special Envoy for Healthcare Service Delivery, Government of Sierra Leone, to please come here and do the signing formalities, please.
Let's welcome sir on the stage. Many congratulations. So with that, we are signing the MOU between both the parties.
So I am His Excellency Peter Mana, Special Envoy for Healthcare Service Delivery to the President of Sierra Leone, and also the founder and CEO of Health for All Medicus. We've been working with Artemis over the years, and our relationship has been very good. We've had 100% success rates for all the patients we've sent to them. So I'm so grateful for that.
Many congratulations. I request both the parties to please stand for a photo op. Thank you so much, sir.
Next, I would like to request Mr. Rimal from Nepal MedCity Hospital to please come on the dais and do the signing formalities. Nepal MedCity is a long associated partner with Team Artemis, and they are the first NABH accredited hospital of Nepal. And Mr. Rimal, he plays a pivotal role in growing the MVT space and healthcare space of Nepal as a country. A great round of applause I request for Mr. Rimal.
Very warm welcome, sir.
Namaste, everybody. My name is Vijay Rimal. I am representing Nepal Medicity Hospital. Actually, we have 6 network hospitals across Nepal. We are planning to have 15 hospitals in every province. Nepal Medicity Kathmandu is the first anyways international accredited hospitals. It's a 750-bedded hospital with all super specialty services. Thank you, FICCI and Artemis Hospital, for this grand opportunity. Thank you.
Many congratulations, sir. I request both the parties to please stand for a photo op. It's our absolute pleasure to have you with us. Thank you.
Next, I would like to request Ms. Nishtha from MMR Medical Tourism Company. Please come on the dais and do the needful for the signing of the MOU with Artemis Hospitals.
Very warm welcome, Ms. Nishtha. Many congratulations. I request both the parties to please stand for a photo op. It's a photo op between MMR and Artemis Hospitals. Thank you.
To take it further, I would request the team Arovia Health, Dr. Shubham, to please come on the dais with his team for the signing formalities.
Let's welcome Arovia Health on the stage. Very warm welcome, sir. We are now signing the MOU between Artemis Hospital and Arovia Health.
So it's a great pleasure working with Artemis Hospital, as I'm doctor myself, so I understand that the kind of environment they are providing for the patients. And already we are getting a huge response from the countries which we are working in. And we are very glad to collaborate with you, and we are looking forward. Thank you.
Many congratulations. I request both the parties to please stand for a photo op. Thank you, Arovia Health.
Next, I would like to request Mr. Sofian from SK Med Globe to please come on the dais and have the signing MOU with Artemis Hospitals. Mr. Sofian is from Algeria, and he's a flag bearer spearheading the MVT space from Algeria, and we request you to please come on the dais. On behalf of Artemis, I would request Mr. Divya Shah to please do the signing formalities.
Let's welcome SK Med Group on the stage. And we are now signing the strategic MOU between SK Med Group and Artemis Hospitals.
I want to thanks again for Fiki to give us this opportunity. And for Artemis also, we're going to build a good relationship and refer more patients and also trainings doctors. So we're going to do a good job, I believe, on this. Thank you.
Many congratulations. Let's do a photo op. Thank you. Many congratulations to both the parties.
Thank you very much.
Thank you. Thank you so much, Artemis Hospitals. With that, we would now move on to the next, and I would like to invite on stage Metro Hospitals. Can we have the Metro Hospitals team on the stage? Hearty welcome, sir. I would now request you
Good
to
afternoon,
please invite
everyone. First, I would like to say thanks, Fiki, who provides such platform here. Now, and special thanks to Mr. Jishan. And now I would like call to my MOU partners, Mr. Paul is the police commissioner of the Cameroon and the country head of the Matrix Healthcare Private Limited.
Let's have a huge round of applause as we have Matrix Healthcare Private Limited joining us on the stage.
Good afternoon, everyone. I want to thank Figi for organizing this exhibition to bring us together from different parts of the world. My name is Kole Ebang Paul. I'm from Cameroon, and I represent Metric. I am the head of Metric healthcare company in the country and the sub-region. I'm here to renew and to continue our partnership with Metro, where we have been working for the past 6 years. And I want to say that Metro, I want to thank them for their flexibility in taking care of patients, especially their welfare, and not looking only on the finances, but the welfare of the patients. And also we promote in-house training for our doctors and nurses. Thank you very much.
I request both the parties to please stand for a photo op. Many congratulations. Thank you.
Now I would like call to SK Med Global from Algeria, Mr. Sophie.
Let's welcome SK Med Global on the stage. And it's going to be the signing between SK Med Global and Metro Hospitals.
I believe with Metro Hospital, we're going to build a strong relationship, and this is the first step, and more business is coming. Thank you.
Many congratulations. Let's do a photo op. Thank you. Up next, we have...
Next, I would like to call Global Docs Uzbekistan, Victoria, Mrs. Victoria.
Let's welcome Mrs. Victoria and team on the stage.
Огромное спасибо докторам, профессорам из Индии и также Metro Hospital.
Many congratulations to both the parties. Thank you.
Now, I would like to call Dr. Subham Chokar, Pavanarth Ventures Private Limited.
Welcome again, sir.
Hi again. So it's great pleasure to work with Metro Hospitals. And actually we are a new company and we are getting new partners. So it's really pleasure. The new partners are always special, I think, and it lasts long. So we are very looking forward to work together. Thank you.
Requesting both the parties to please stand for a photo op. Many congratulations. Thank you, Metro Hospitals.
Thank you so much.
Thank you, Metro Hospitals. With that, we'll now move up next, and I would like to invite Leelavati Hospitals on the stage. Can we please have Leelavati Hospital on the stage? Very warm welcome, ma'am. I would now request Leelavati hospitals to please declare their MOUs, one at a time.
So this is Priyanka. First of all, I would like to thank FICCI and the team to organize this event. It has been a very positive response for us. And of course, a lot of people were very happy to see Leelavati here. So out of all the MOUs that we have signed, I would like to invite Mr. Salian from West Africa Agency of Medical Assist. Sir, please come on the stage.
Can we please invite Mr. Salian to please join us on the stage? Welcome again, sir. We're now doing the MOU signing between both the parties. I now request both the parties to please stand for a photo op. Many congratulations to both the parties. Thank you. Up next.
Next, I would like to invite Mr. Hassan Al-Haji, Medical Services Office from UAE.
Next up, we have Medical Services Office from
UAE. Saudi Arabia. Please come. Yes.
Hello everyone, I am Hassan Muhammad Al-Haji from Saudi Arabia. Since decades we are believing in treatment in India, and I start my activity since 2015. That's why I have to start increase my number of hospitals I'm dealing with. I trust everyone here. Thank you for everyone.
Many, many congratulations.
Thank you so much, sir.
We request you to please sign the MOU. Requesting both the parties to please stand for a photo op. It's indeed our pleasure to have you associated with Leelavati Hospitals.
Thank you so much, everyone. Thank you.
Thank you, ma'am. With that, we'll now move on to our next. It's my pleasure to invite on the stage AHCI Hospitals team. Very warm welcome, and here we meet again. I will now hand over to AHCI to please declare their MOUs.
Good afternoon, everyone. I'm Archana Bhalla. With the pleasure, I would like to call Global Link Travel from Kigali, Rwanda. Oliver.
Let's welcome Mr. Oliver on the stage. I now request both the parties.
My name is Oliver, and I'm happy to sign an MOU here. As usual, India is our second home for our patient for treatment, and they feel happy for the service. Thank you.
Many congratulations to both the parties. I request you to please stand for a photo op. Thank you. Thank you, Mr. Oliver.
Now I would like to call InMed Travel, Dr. Poonam Rana.
Let's welcome Dr. Poonam Rana on the stage.
Hi everyone, this is Dr. Poonam. I'm a co-founder to medical tourism company called as InMed Travel. We are a Mumbai-based company and we are looking forward to sign more MOUs with Delhi-based hospital. So please connect.
So with that, we are signing the MOU. I request both the parties to please stand for a photo op. Many congratulations. Thank you.
Now I would like to call Stephen from Ruora Pharmacy, Kenya.
Let's welcome Mr. Stephen on the stage. Many congratulations, sir.
Thank you so much. My name is Steven Muriuki from Kenya, representing Rural Pharmacy. I'm so much pleased by the whole organization, by FICI. It's a job well done. And we've been sending patients to India for some time. And we are in the process also of starting a specialty hospital in Kenya, a place called Konza Metropolis. So we'll be partnering with more doctors to come and do their expertise in Kenya. And also those people who are interested in investing in healthcare in Kenya, you're welcome. Thank you so much.
Thank you, sir. Let's do a photo op. Many congratulations to both the parties. Thank you so much. It's our absolute pleasure to have you with us.
Now I would like to call Mr. Hassan Al-Haji from Saudi Arabia.
Again, thank you everyone. I am happy to be here and I will continue coming to this country. Thank you.
Many congratulations, sir. I request you to please sign the MOU. Thank you and many, many congratulations.
Though we have signed 12 MOUs, but I'm difficult to find the delegation, where are they? So I wind up here with the MOUs.
Thank you so much, Ms. Bhalla. And with that, we'll now move up to our next one. And I would like to invite on the stage MyCare India. Can I please request MyCare India team to join us on the stage? Very warm welcome, ma'am. I would now request MyCare India team to please declare their MOUs that they have signed, one at a time.
Yeah, good afternoon everyone. I'm the founder of MyCare India. So I would like to call upon stage Egypt in Touch.
Let's welcome sir on the stage. Very warm welcome.
Hello everyone, this is Dr. Ahmad representing Egypt in Touch. We are happy and glad for this opportunity from Vicky and to cooperate with MyCare. It's our pleasure. Thank you.
Many congratulations. I now request both the parties to please stand still for a photo op. Thank you. Many congratulations, sir. You can. I would now request you to please invite your next partner.
Yeah, now I would request Vaha's Healthcare from Senegal. Mr. Vaha.
Welcome again, sir.
Thank you so much for giving us opportunity.
Yes, thank you to offer me this opportunity to work with your hospital, and it is a very pleasure for me. I come from Senegal. Thank you.
Many congratulations to both the parties. Thank you so much. Up next, we have
Mr. Kennedy from Kenneth International Hospital.
Can we please invite Kenny International Hospital on the stage?
Mr. Kennedy. He was there, I think. Okay, no problem. So we'll go for next.
Yeah.
Thank you. So I'd like to call upon stage Madam Sonam from Kyrgyzstan.
Let's welcome Madam Sonam from Kyrgyzstan on the stage. Hearty welcome, ma'am.
Hello, everyone. I say thanks, a lot of thanks to you.
Many congratulations to both the parties. Thank you. Thank you so much, MyCare India team. Are there any other hospitals who would like to declare their MOUs? Any other hospitals who would like to declare their signed MOUs? Please join us. Let's welcome Chitrakuta Ayurveda team on the stage, and they'll be declaring their signed MOUs.
First of all, I would like to thank Vicky for the organizing wonderful event and giving us the opportunity to connect globally. First, I would like to call Egypt in Touch, the MOU with the Egypt in Touch, Dr. Fahim and his team.
Let's welcome Dr. Fahim and his team.
I would like to call SK Med Globe from Algeria on the dais. Ayurveda is the Indian system of medicine having the history about 5,000 plus years. So we are MOU with the SK Med Globe.
Once again, thanks Vicky, thanks India.
Thank you.
Thank you so much, sir. Many congratulations once again. And with that, we would now invite on the stage MFly Services Private Limited. Very warm welcome. I would request you to please invite your partners one at a time.
Sure. Hi, I'm Basudha Shrivastava Narula, and I'm representing MFly. MFly is an AI enterprise partner, and I'm happy to share we have signed a MOU with National Neuro Center and Multi-Speciality Hospital. Mr. Yajan Kadka, please come on the stage.
Let's welcome sir on the stage. Many, many congratulations.
I would like to call Mr. Birjung Nepal from Bijay K. Kimal from Nepal Medicity. Yeah, please, Vijay, please come on the stage. I'm really sorry I mentioned Bijung Nepal. That's where the company is being registered. I'm glad to know that they have a huge hospital in Nepal and with more than 750 beds and more than 1,000 plus OPD patients every day.
Very warm welcome, sir, and many congratulations.
Yeah, thank you once again. This MOU for, actually we are recently acquired a 150-bedded hospital in Madhya province. It's a Nepal Medicity Vayuda Hospital, Birganj, and thanks to Fiki for this opportunity.
I request both the parties to please stand for a photo op. Up next, we have
from Bangladesh, Mr. M.M. Masumuzzaman from Siok Healthcare.
Let's welcome Siok Healthcare on the stage.
Hello, sir. Do you want to say something?
Yeah. Hello. Good afternoon. This is Masum Zaman from Siok Healthcare, Bangladesh. We are operating a medical tourism company from last 13 years. I have my own office in Bangladesh, 7 offices, and I have my own office in Cambodia also for focusing the ASEAN countries. Okay. Thank you. It's a great pleasure for me to join this event. Thanks, everyone.
Many congratulations, sir. We request you to please step up for a photo op. Thank you. Up next, we have
I would like to call Mr. Austin Mena from Zimbabwe from Healthy Living.
Can we have Healthy Living team join us on the stage?
Mr. Austin Mena.
Do we have Mr. Austin Maina with us here in the conference hall. Mr. Austin from Zimbabwe. All right, thank you so much, MFly Services Private Limited team. So ladies and gentlemen, with that, all our hospitals, our partners have signed their MOUs. Let's have a huge round of applause for all the MOUs being signed for both the parties. So ladies and gentlemen, as every good thing comes to an end, so has this very prestigious conference. On behalf of the organizers, we would like to thank you for being a part of this journey and for contributing to the success of the conference. And I would also like to thank all our dignitaries, our government officials, delegates, sponsors, industry peers, senior officials, members of the media, exhibitors. I just got an intimation that we have one more MOU being signed. So I request all of you to please remain seated as we get that MOU signed as well. We've now welcomed Kailash Healthcare team. I would now request you to please declare your MOU being signed with the partner. Towards the center, please. If you could please declare the name of the partner. There's a mic.
A very good afternoon. My name is Muhammad Ali Fazari. I am from Sudan.
Many congratulations, sir. Thank you so much. I request you to please stand for a photo op. Many congratulations, sir. We would also like to invite Nepal Medicity Center to please join us on the stage. They'll also be signing the MOU between Kailash Healthcare. Many congratulations, sir. This is the last MOU being signed between Kailash Healthcare and Nepal Medicity. Many, many congratulations to both the parties. Thank you. Do we have any other hospitals? All right. So with that, we finally come to the end of this very prestigious conference, ladies and gentlemen, the 8th edition of AHCI 2026. And I would like to thank all our dignitaries, government officials, delegates, our sponsors, our industry peers, senior officials, and members of the media, and of course our exhibitors for making this conference a great success. Lastly, I would like to invite the entire organizing team of AHCI to please join us on the stage for a group photograph. This entire conference would not have been possible without the relentless efforts of this hard-working team who has been giving their best since months now. So can I request the entire team to please join us on the stage? Ishan sir, Jishan sir, Garima, Anshu, Aditi, Mandvi, Ravin, Sujit, and the entire team. I would have missed out on a few names, but I'm sure we all know how much efforts all of you have put in behind each and every session that was planned as a part of this entire conference. Can I request the entire team who has been the backbone of this conference, Mandvi, Aditi, the entire team. Quickly requesting everyone, this is going to be the last opportunity for the photo op, guys. So you need to hurry a little. All right. So Mandeep, Sujit, Divakar, any names, even if I am missing out on, FICCI team, please join us on this stage. I know you have put in a lot of efforts behind this entire conference for making it a success. So I'm requesting the entire team of AHCI 2026. Let's have a huge round of applause for this team, ladies and gentlemen. The team that you see on the stage are the real heroes behind this entire conference. So let's have a huge round of applause for them. They have been working day in and day out to make this conference a great success. Calling speakers, planning the agenda, everything. I know the serious photo has been taken, but we need to take a victory photo as well. So all right. 3 chairs for this entire team. On the count of 3, 2, 1. Hip, hip. I need to hear it from all of you. Hip, hip. Hip, hip. Why to be so silent? I need to hear it from all of you. I know you have put in a lot of efforts. So वो efforts अभी दिखने चाहिए और सुनाई भी देने चाहिए. So on the count of 3, 2, 1. Hip, hip.
Hooray!
Hip, hip.
Hooray!
Hip, hip.
Hooray!
Perfect.